Good evening. I'd like to call to order the virtual meeting of the Lakewood City Council on October 19th, 2020. This will be a study session, and I would ask if the clerk please could call the roll.
Paul?
Here.
Abel?
Here.
Vincent?
Here.
Gutwein?
Here.
Vita?
Here.
Skilling?
Here.
Springsteen?
Here.
Franks?
Here.
Johnson?
I'm here.
LeBreer?
Here.
Harrison?
Here.
You have a quorum.
Awesome. Thank you very much. I'd like to again welcome those who are tuning in this evening or at a later date. We have a couple of great and meaningful presentations before us tonight. One deals with Coalition to End Hunger in Lakewood, and the second one is homelessness, and certainly important topics. I would just reiterate that this is a study session, so we do have public input portions, not general public comment. Those are reserved for the second and fourth meetings. So if you'd like to speak on either item 3 or 4, we just ask that you make your comments part of the discussion. This is kind of your opportunity to ask any questions or any suggestions based on the presentations. Phone number tonight is 1-699-900-9128 with the webinar ID of 928-8207-9997. I believe that should be flashed up on your screen as well. You'll press pound after entering the webinar and then *9 to request to speak and *6 to unmute with 3 minutes. So going forward to the first item is a presentation update by the Coalition to End Hunger. And I'm going to turn it over to Mary Ruther to introduce our guest. And this presentation is on Lakewood Speaks. It's about 13 minutes long. So if you'd like to watch that, you can go to lakewoodspeaks.org also. Good evening, Ms. Ruther.
Mary, you are muted. Can you unmute yourself?
How's that?
That is perfect. Good evening.
I'm so sorry.
That's all
I'm so
right.
sorry.
Don't worry.
Okay, well, good evening, Mayor and City Council. Tonight, Jane Barnes, who is the Executive Director of Benefits in Action, is going to provide you an update on the Coalition to End Hunger in Lakewood. She has been providing the chairmanship for this initiative started by the mayor in 2018. So with that, I will introduce Jane Barnes.
Thank you. Good evening, Ms. Barnes. Welcome, and thank you for joining us and for your wonderful presentation, which is online, and now we have you live.
Hey, it's your lucky day. So thank you. I'm glad to be here and see all of you and talk about this really important issue to the city of Lakewood. So I did record a presentation for you all and sent a PowerPoint. So I'd really just like to have an informal conversation and see what you all are particularly interested in. And then maybe I can wrap up with, we'd love your help once we've answered some questions for you. So I would just want to remind you that we have about 32 different organizations in Lakewood that participate in the Coalition to End Hunger. And when we started, this was one of the 3 coalitions that Mayor Paul has started in the city. You all know there's the Lakewood Faith Coalition, there's the Lakewood Service Organization Coalition, and the Coalition to end hunger in Lakewood. So all great ways of pulling folks together so that we can collaborate with one another to better meet our community's needs. So with that little introduction, do you have any questions, any thoughts?
Sure, I'll kick it out, and just so folks who may not be familiar and are tuning in and haven't seen the presentation, this is part of a overall program called Lakewood Linked that was actually started under Mayor Murphy. And it's the idea of how can we come together in different ways in the community to really address a lot of the issues that we are facing. And that did start with the Faith Coalition. And they've started to do some incredible work at our Title I elementary schools. And so we certainly know that there's a lot of food needs in our community and a lot of folks providing food resources. And so sometimes you just got to get them together to the same table and to talk to really understand what the needs are. So for instance, we had food banks that were virtually next door to each other, but yet you could go a few miles away and there would be no resources. So this really was a way to start the dialogue. And in your presentation, you talk a lot about equity and trying to figure out, where to go. There was a small grant, I think, given to help with some of our, to even do more services at some of our Title I elementary schools. And there was a grant that you did receive to continue some coordination. So that's kind of a quick overview for those folks who may not be too familiar with this. And I guess my first question would be, how can we continue to help support the mission, or what are some things that you see as a need right now as we look to address the hunger issues in the city?
Mayor Paul, thanks for the question. I think that there are a number of things that City Council can do to support us. And one of the things we're looking at is there's been a project done out of actually the University of South Carolina Medical School and by the Academy of Nutrition and Dietetics. So it's an evidence-based process that communities can go through really to prioritize food security solutions. So right now, that's one of the things that the coalition is looking at. We've already done a number of the things involved in that. We've identified where food pantries are, which is a ever-changing landscape, I might tell you. We did a lot of this work pre-COVID and then really came together during COVID to maximize our food distribution in the city. So now we're kind of back, what's next? What are our next steps to do? But this process is really interesting, and I think what's great about it is it's evidence-based, and it really kind of lays out what we should be doing and who we should be talking to. So I think one of the big things is our group really has been made up mostly of folks who are involved in the food distribution system in Lakewood, food pantries, food advocates, food delivery folks. And we really need to sort of broaden our horizons and bring together all the other entities that may be affected by food insecurity. So certainly schools are at our table, but we have not had a big response from the healthcare provider community, and that's partly our fault. So we're not blaming anybody here. We'd love to have some of the food retailers involved. So if you all could help us bring together some of those folks as we really try to fix this food insecurity issue that we have in Lakewood, and make people's lives a little better, and really working towards sustainability here. So the idea is not to just feed people for the rest of their lives, but to really help them get through sort of the crisis that so many people are finding themselves in right now. Some of the latest data is showing us that 1 in 3 Coloradans are hungry. That's huge, right? Those are not numbers we've seen before. And certainly those are in different parts of the state, but I think we really need to think about families that are struggling to keep a roof over their head right now. They've lost their jobs. We're in a really different world than we were 8 months ago. And so really trying to figure out how do we best serve our community now and build an infrastructure that will support folks moving forward. So did I answer your question?
Yeah.
Sorry, I'm a little passionate about this topic. So
no, it's fantastic. And it's important to note that this is really driven by volunteers. And you've seen, there's a couple of highlights of the action steps, and certainly one of the keys is to coordinate a website so people have an idea of where to go. Are you seeing right now, is there an increase of certain items or certain things that the community is needing or running out of? And what's the best way, if people want to get involved, how do you get involved, and how do you make sure that that is, being strategic in what you want to do if you want to engage?
Great question. I think that certainly we are seeing lots of things, food drives, folks like the Action Center really, who got most of their food from community donations. A lot of food pantries have gotten their food from community donations, are no longer seeing those donations, right? People weren't going to the grocery store. When they did go to the grocery store, items were limited. People were worried about where their money was going to come from for their own groceries. So food pantries really had to start purchasing food. Jefferson County's done a great thing in pulling together a food pantry network and providing some funds that will pay for food, but that goes through the end of December. So not sure what's going to happen in January when that funding's not available. So food is actually quite expensive. I've learned a lot about food in the last 6 to 8 months, I can tell you that. Our organization was really involved in working to support folks accessing benefits such as SNAP and locating food pantries, not actually being hands-on in this business. So we have learned a lot. So I think donating to your local food pantry, the one you love, is a great thing to do. Churches are really stepping up to the plate to try to fill in some of the gaps. Schools are really trying to work with their families without volunteers and parents being able to go into school buildings right now. It's made that a little more challenging. And the Jeffco Schools Foundation, in collaboration with the Lakewood Faith Coalition and the Coalition End Hunger in Lakewood, were just awarded a Lakewood Cares grant, and we really appreciate that. We will be setting up 3 food hubs in Lakewood elementary schools. So we're pretty excited about that. We've had a couple meetings with the school district already. And so that's moving along. These are really highly impacted schools that have not had this kind of access to support from the community. So we're pretty excited about that. So thanks you all for making those dollars available. It's been a great help. And, I think we're really trying to figure out what's next. I think we all really came together and really did great work through the early days of COVID. We know those days aren't over yet, and developed a lot of great relationships. And now it's really our task to think about what's 2021 look like? How long do we expect this really difficult situation to last? How do we continue to move forward as we plan for the future? So just like you are thinking about what's next for the city, I think we're all thinking about how do we plan in this world and what's that look like? So that's a big part of the coalition's work right now as well.
I just have one final question that has to do with anything legislatively, and you may not have an answer right now, but I know, throughout there is a food call every Friday morning throughout Jefferson County. And one of the things that we learned is there were some issues with Food Bank of the Rockies and how they can distribute their food or who they can distribute it to. And so it looked like it needed some help from the state level to get that fixed. But are there other legislative things that you see? And if you don't know right now, please know, that we are here to try to carry that forward too, if there needs to be some fixes to help make sure that we're getting food to hungry people in our community.
A lot of this work actually happens at the national level as well as the state level. So we've just learned that the waivers for children, so all children basically in schools will be able to get lunch and meals at no cost to them. So we saw that this summer. It was sort of emergency food funding. It's now once again being implemented in the schools. So it's not just kiddos that are on free and reduced lunch, but actually all children will be able to get that. So gets rid of some of the paperwork for folks at this point. SNAP benefits have been increased That's a month-by-month basis. Colorado, every state has to apply. Not every state receives it every time, but that's made a big difference for our older adults. SNAP benefits often are limited for older adults because of their Social Security income. And so they may get $16 or $20 a month, and they've actually received the maximum SNAP benefits for the last several months. So it's going to be quite a surprise to folks when that's no longer in effect. And people are probably not going to be very happy, but that's been something that the USDA has implemented. So a lot of the food stuff is managed by the USDA, and so that's a really different organization than we're often used to with human services. They work very differently. Their rules and regulations are very different. So it's been great that there's been so many waivers during this really pandemic while we've tried to figure out how to do all these things. The challenge, of course, is when those waivers are over, how are we going to deal with it, and how are we going to explain that to the general?
All right, thank you. Council, is there anybody has any questions or comments? Councilor Beda.
Thank you, Mayor. And thank you, Ms. Barnes, for your presence tonight and your presentation. I'm just going to say real quickly, we see a lot of the successes here on council and even out in the community where, participating in the food banks and the distributions, we see those, and those are the successes where, people are getting the support they need, and that's great. What I don't think we see, and I don't see at least, is where the failures are, where we're missing the mark. I'm pretty sure we are in places, and I don't know where those are. And so I think for us to really do what we can at our level, we need to know where those are. And so anything that you can do in your group that can help us either today or down the road to know where we're missing the mark and what we can do. We've got a lot of creative people between our council and our staff. We've got some very creative, smart people, and they can maybe help with, some small way with solving the misses. So I just ask you to keep that in mind. I, for one, would like to know where are we falling down.
So we've done a lot of mapping. We had a small grant. You all saw that in the presentation I gave to you all from the Colorado Health Foundation. So we did a fair amount of mapping of where food deserts are. Those are places that folks may live a mile or more away from a grocery store, any kind of place where they can buy food. We worry a lot about neighborhoods that the only accessible food purchase is a convenience store. Not exactly the best nutrition and certainly not the best prices for folks, although they do take EBT cards, which is your SNAP sort of debit card. We've also done a lot of work with where the poverty is in the city and how that overlays with where the food pantries are. We know there are some pockets where there aren't pantries and there may be need. We also know that the need is changing right now. And so, our maps are just as good as the data that we collect for those. And, I think the challenge is figuring out where those gaps are and then what we're going to do about those gaps. I do want to caution you that in these days, I think we really have to be thinking about is folks may live in a nice house, they may drive a nice car, but nobody has a job. And so food may be the thing that's not happening, or parents are working so hard to keep that roof over their head that they're not feeding their children well. And there are hungry children in every neighborhood. So we want to make sure that we remember that and that we figure out what to do, how to deal with those issues. And really educating our community is one of the best ways that we can begin to eliminate a lot of these gaps. So you all can help us get the word out. We really appreciate that. And certainly we're also, I would be happy to, and many of the folks from the coalition would love to come to some of your town halls and talk about this issue with your constituents when you think it's appropriate or when you think you have questions. So would love to participate.
Mr. Vita, go ahead.
Yeah, just as a follow-up, one of the things that I've noticed, and I think it kind of goes with what you're saying, is two things, just observations, but very interesting. One, I'm sensing that one of the problems is transportation, that people can't get to the food banks, or they don't have a way to get their supplies. We see a lot of that at Food Bank of the Rockies, where people are getting supplies for 2 and 3 families, not just their own, but other families that they're trying to help out. We see that a lot. The other thing is I've been getting correspondence now for help actually making distributions within the city for Food Bank of the Rockies, where if you could, if you have a vehicle and if you can lift 40 pounds, can you volunteer to come and help us make distributions to seniors and people that are shut in? So that seems to be a real problem out there is transportation, and of course identifying those that need that transportation. And then the other thing is, you're right, I see a lot at the food bank, people coming in with brand new cars. I mean, very expensive vehicles, and you can see they're a little sheepish about it, but the need is there. And so it's people that have been well heeled in the past and have run into some serious problems, and you see it all the time. So I guess I agree with you that my observations tend to track with what you're saying.
So thank you for that. And there are a couple of programs that started out doing just what you talked about, which is delivering food from food pantries to families in the city. So happy to send the names of those to you all, but there's a website that folks can go to and just sign up to have food delivered. That's biaction.org. It's really easy, doesn't ask a lot of questions. And folks in the faith community are signing up to be drivers for those programs to deliver food to folks in their communities. So it's a great, it's a great win-win for everyone. Folks can't get out to get food for a variety of reasons. Transportation is certainly one of those, as especially all the older adult transportation stopped running during COVID, and to a great extent, any of the special trips are no longer going. So Lakewood Rides has been delivering meals to those folks that used to come to the Clement Center for congregate meals. So, or lunch, in layman's terms, lunch. I think there are other things that are happening around the city, actually, that have been really innovative and pretty exciting.
All right.
If anyone wants to drive, I'm sure there's a place that can
certainly
deliver food. And you're right, hoist a 40-pound box up a flight of stairs. So,
so I have Miss Harrison and then Miss Johnson.
Thank you. Jane, would you go back and talk a little bit more about the kids' meals? I think you said that there was an expansion to children's meals at schools. Mm-hmm. Would you go into that a little bit more?
Sure. I'm probably not the best person to talk to you about that, so I want to make sure I get it straight for you all. But there's been a waiver by this is a joint effort with the Colorado Department of Education, or the U.S. Department of Education and the USDA. So there's been a waiver so that families don't have to prove that they're eligible for free and reduced lunch to be able to get free meals. So families can go and pick up, and the school districts are doing several things right now. You all may have heard of this. For the kids that are in school and doing in-person learning, there's certainly breakfast and lunch at most schools, at least the highly impacted schools. For kids that are on a hybrid schedule, on the second, let me try to get this right, on their second day of in-school programming, they take meals home for the other days that they wouldn't be in school. Get 5 days of lunch and 5 days of breakfast. And then the kids that are all doing remote learning at home, there is a time block at each school where families can go and pick up lunches and breakfasts. So that will be a little easier now because people don't have to fill out the forms for free and reduced lunch, and it's a little confusing. sometimes.
Okay,
So,
thank you.
especially as their income changes.
Right.
So,
Thank you.
Okay,
I
we
hope
have
I got all that quite straight. I think I did.
But we can make sure we can get the more information
Yeah,
out.
I'm happy to send that to you.
All right, we have Miss Johnson and Miss Gutwein.
Hi, Jane. Nice to see you.
Thank you.
Actually, you answered my question. I was going to ask if there'd be a way to get us information in some of these different places that need supplemental help. That would be helpful.
Happy to do that. I think one of the things we'd like to do with the website with the coalition is be able to advertise and recruit for volunteers sort of on a citywide basis. So that's the other thing you all can help us with. So I'll send you some information.
Thank you.
Miss Gutwein?
Thank you, and thank you for this update and for the work that you're doing, Jane. And it's good to see you. Also, you did a great job highlighting the Jeffco Schools food program, which has been a big deal for a lot of families. I just had a couple of other questions. If people want to get involved as a volunteer, how should they email you, or what's the best way?
Sure, that'd be great. They can email me and I can send it out to the group.
Great.
You know, and we'll try at our next meeting. We meet the first week in November, so we'll try to get folks to list their volunteer opportunities. I'll send an email before and try to get that out.
Awesome.
To the city, and maybe you all can help us get that word out. So,
yeah, I'm sure that we would all be happy to do that. And
great.
The other thing I had a question about is kind of similar to what Councilor Bita was asking, but instead of about transportation, if you're seeing a lot of issues from families that don't have internet access, or and then struggling to, look for jobs or look for services or even find out where the food bank is, and if that's something that you're seeing and hearing.
That's gotten a little bit better since the library opened, right? At least in limited. It was really tough for folks when the libraries weren't open, and you may know some of them expanded their service so that folks could sit outside and get access to their internet from outside the building. So that's helped a lot. Certainly you can call 211, which is United Way, and get forwarded to food banks near you. Hunger Free Colorado is a great resource. You can go online and or call Hunger Free, and they continue to keep a listing of all the food pantries and try their very best to keep that updated. There's a great little Facebook group, and I think you might have to be invited or accepted to join it, I believe, and it's called Jeffco Angels. And pretty much every day they list what food pantries are open and available in Jeffco. So, that's a way for folks to do it. What we find is most people have a phone of some sort, a smartphone, which is their whole communication, right? So as long as they have minutes and data, they can access information. So some times of the month are better than others for people to be able to access it. But I think some of those resources are really good. And they're also, just going to your food pantry, and pretty much everybody knows most of the other resources in town. The Action Center is a really great resource. Right here in Lakewood, all the churches are really helpful. I think it's been really remarkable to see how the community has really stepped up to support their less fortunate residents. So it's really pretty heartwarming to see how many people are stepping up to help in a variety of ways. It's sort of volunteerism that we haven't seen for quite a while. So but there's always need for more. Always need for more.
All right. Well, thank you.
Sure.
Okay, so I do not see any other hands up for council. So I would just, again, thank you, and thank you for all your work and the coalition as well. Please send our gratitude. It is refreshing to hear so many people interested in trying to help, and certainly want to give Miss Ruther a shout out, who helps coordinate all of these different groups and does an incredible job on that end, really making the lives better of so many in the community. So we look forward to continuing to support your mission and see you move forward. And really, if you know anybody who's out there watching in need, please connect, get in touch with one of us, and we'll certainly try to make sure that you're connected with some sort of resource. This all started because we're far too great of a city to have anybody go without, and we can truly make a difference. So thank you, Jane.
Oh, thanks for your time. I appreciate it. And we're happy to send you when our meetings are for the coalition. If any of you would like one more Zoom meeting, we'd love to have you participate. We'd actually love to have somebody from the council join us. So,
that'd be great.
Let us know. Yeah.
Okay.
Thank you.
All right.
Thank you all. It's great to see you all. Thanks for doing the work you do. We appreciate it.
Okay, so this is the public input portion of this. So this is your opportunity to weigh in on this discussion about the presentation that you just heard. If you have any questions or comments about that, that'd be great. Again, the phone number is 1-699-900-9128. Webinar ID 928-8207-9997. You'll press pound and then *9 to request to speak, *6 to unmute, and we'll get your 3 minutes going if you want to give us your name and address, or name and ward, and we'll start this portion. So, Madam Clerk, if you please.
Yes, we have Eric Brandt.
Okay. So, Mr. Brandt, if you are here, please go ahead and we'll get your time started.
Good evening. Can you hear me?
Yes, sir.
Okay. I want to thank you, Mr. Mayor, for hosting this so graciously tonight. I know with your history of gentrification that this is difficult for you to consider giving any resources to the homeless other than helping them to move out of the city. So I wanted to just start by thanking you for that. I wanted to ask, in today's day and age, we're beginning to suffer the serious impacts of global climate change. And with COVID and the economic downturn, I wanted to ask Ms. Barnes if the group is considering or already engaged in activities to help teach people who are becoming impaired with their food source to preserve food. I know that with the Action Center right behind my house, I see a lot of people there. There's a lot of food that goes to waste because it doesn't get preserved in time. We certainly are throwing away a tremendous amount of food. And as Mr. Beta pointed out, these are a lot of people coming to these that very recently weren't insecure in their food, and now they're becoming insecure. So maybe we should be acting as a community and teaching ourselves how to go back to some of these old-fashioned trends where we were able to take these kinds of food items and preserve them. Maybe they could be groups with the churches that may already have kitchen resources, and we could teach people while we're preserving these foods to make them more available to people that don't have the ability to cook and preserve food.
Okay. Anything else? You have anything else on your comments here?
Oh, that was just my question for Ms. Barnes.
Okay. All right. Well, we'll get that done after we close down this portion and see if she has an answer for you. Okay. Madam Clerk, anybody else with their hand up?
No.
Okay. So I will close this portion of the public input. Ms. Barnes, is there anything you wanted to address on that?
Well, I think one thing that I neglected to be sure that I mentioned to you all is the coalition to End Hunger in Lakewood also includes local farms. So I want to make sure you understand that. And Mr. Brandt, I think your question is a great one about preserving food. It seems like we've had some conversations about that. I think in this current time that we're in, public health really has kind of frowned on us doing the cottage food as they call it, kinds of things, which are churches preparing food and distributing prepared food, those kinds of things that the members do. But I think it's a great idea, actually, and we could find someone who's willing to teach. And probably one of the churches, you're right, most of them have commercial kitchens. That would be a great thing for folks to learn. I lived on the Western Slope for a while and did lots of preserving of fruits and vegetables, and it's a really great way to feed your family for very little cost, actually. So I welcome that. So thanks for the ideas. We'll take it back to the group.
Cool. All right. Well, we appreciate you again. Thank you very much, and we will certainly be in touch and get moved on to our next item tonight, which is a presentation discussion update on the city's homeless efforts. So I will turn this over to Ms. Hodson, who is one of the city managers that was tasked with this as a priority by all the cities in the county, and became, I think, the de facto ringleader of trying to solve this problem throughout the county, and have certainly done an incredible job, and look forward to seeing how much that needle has been pushed. Certainly never enough, as we all know, but this is quite tricky, quite challenging. So the floor is yours.
Okay, thank you. Good evening, City Council. So this actually came from a request from you, from City Council, to receive an update on the efforts toward homelessness in our community. So this is really the intent of this presentation, is to provide information and to help educate you on what's been happening to date. So I'm really excited because we've got several guest speakers tonight, and we're going to conduct this presentation in two different, very distinct parts. The first one will be around our regional partnerships. And we have some folks for our leadership, actually, from Jefferson County, who will be giving a presentation of kind of the broad view of the collaborations in our county. And then we're going to drill down a little and talk specifically about our local efforts here in Lakewood and what Lakewood's response has been to the broader Jeffco efforts, and how we're individually responding as a city. And we really do work in harmony with the county. It's a really special relationship where we work really well together. And I say that with great pride. So first, by way of introductions, I'd like to introduce the county, the Jeffco County team. And they're led by Mary Berg, who is the Executive Director of Jeffco, Jefferson County Human Services. We're lucky to have Mary on deck today. Also, we have Kat Douglas, who's been intimately involved in all of these efforts around the homeless population. Kat is the Director of Community and Workforce Development Division in the county. And finally, Kelly Barker, who's been on board about a year now. She was hired by the county. She's the Regional Homeless Coordinator. So first, again, you're going to get a presentation from the county to hear the broad efforts by way of the whole county. And then I'll introduce our team, who will do the second part of the presentation. So with that, I think I'm not sure, Mary, will you give the introductions on your team? If not, who's it going to be? Kat? Is it Mary or Kelly or Kat? Kat, can you hear me? Okay, Kat can. There's Kat. How about Kelly? Can you hear me? Okay, so we don't have your audio working. Let's give it just a minute and we'll get this started.
Can you hear me now?
Perfect. Yep, this is Kelly Barker.
Okay, I think Kat, are you able to get on, Kat, or did you want me to go? Okay. Okay. Well, I'll I'll go ahead and get started. Sorry, the audio was a whirlwind there. So let me share my screen, pull up my presentation.
Oh.
Okay, can you all see that?
Oh, wonderful, yes.
Okay, I'll make it a little bigger. Oh, okay. So, hi everybody. Thanks so much for having us tonight. My name is Kelly Barker. As Kathy mentioned, I'm Jefferson County Regional Homeless Coordinator, and I work with Jefferson County Human Services. So as Kathy mentioned, I'm just going to give about 15-20 minute, very high level overview of what's happening throughout the county around coordination around homelessness issues. And then John and Amy will jump into Lakewood specific response. So here's kind of the four main pieces that I'll touch on today. I want to talk a little bit about the Heading Home Collaborative, our regional homeless navigation model, kind of what the status is with that, and then the severe weather sheltering response for this season. And finally, the non-congregate shelter for our homeless residents who have been diagnosed as COVID positive. So I'll go ahead and get started. I apologize, I realized the date is off there. So just high level overview of Heading Home. So I'm not sure what level of familiarity most of you have with this. Heading Home it started basically in 2007 as just a small, loose, informal group of individuals, nonprofit organizations, some local government, faith-based providers, whatnot, kind of a group of individuals that came together and wanted to start to address this growing issue of homelessness in the county and start to come up with some solutions to address it. So, and then in 2011, it became a subcommittee of Jeffco Connections. So I'll kind of recap what Jeffco Connections is for those of you that are not familiar. But now it's a formal subcommittee of this group. Its mission has remained the same through the years, and that's really to create a systemic response in Jeffco that prevents and ends homelessness wherever possible. And when it cannot be prevented, ensures it's a rare, brief, and one-time experience. So we know that homelessness is a community-wide crisis, and it affects all different sectors, from business to our law enforcement to churches to everybody. It really touches on all facets of our society and our county. So it really requires a community-wide solution. So that's why Heading Home is really unique in that it includes a very diverse group of stakeholders at the table. So we have nonprofit, business, government, faith-based, private citizens all at the table at Heading Home that really work together collaboratively to create solutions. And Heading Home, because it's not a nonprofit, it doesn't accept funds into it and doesn't grant out funds. The function of Heading Home is to come together, all of those diverse stakeholders, focus on doing strategic work. So gathering data, identifying what the issues are specifically, what are the gaps in services that we need to fill to be able to properly respond to this issue, and then come together and determine what are the best practices that we can devise to address this issue, and where would that practice best lie in our community, what nonprofit or government or a church or whatnot. One of the most significant, I think, accomplishments of Heading Home that's a really good example of how they function to create responses is they were really the impetus to create Severe Weather Shelter Network, which is a local nonprofit that serves basically the whole county, and was developed, I think, about 9 years ago. And it's a faith-based nonprofit, and they really came together as a result of the conversations at Heading Home to say, yeah, we really need to at least address and provide a shelter for our residents that are unhoused during severe weather nights. And so that solution was developed, and it's still going. It's still very successful, and it's in fact growing to respond to a growing need in the county. So, as we've expanded, and as my position, I've been in this position for about a year now, the issue with Heading Home through the years is there hasn't been paid staff. It's been entirely volunteer run. So now with my position, I'm able to come in and actually dedicate a time to giving it more structure, to setting specific goals and holding those goals, the group accountable for those goals, and myself as well. So we're really ramping up, expanding all the goals that the group hopes to accomplish. And we're doing that through the creation of what's called a Homelessness Action Plan. This is there has been a rough plan in place since 2013 to address homelessness. It was a really large plan, and as a result, didn't really get much traction through the years. So we're really revamping that now, and we've completed the first draft of that, and I'm going to dive into that here shortly. But just in the last year, we've created a lot of more infrastructure in Heading Home, created governance guidelines and membership structure, and then drafting this plan and work groups as well. So we're really moving along, as this will be like kind of the spearhead of the response to homelessness countywide and include all the municipalities at the table, and the nonprofit service providers and faith-based groups and everybody. So here, these are the websites of Heading Home. I encourage you to check that out when you have the time. We're kind of in the midst of a little bit of a facelift of the website, but the information on it is currently accurate. So Jeffco Connections, I mentioned Heading Home is a subcommittee of Jeffco Connections. Jeffco Connections, for those that are not familiar, is formerly known as CYLC, the Jefferson County Child and Youth Leadership Commission, which was created in 2008, and it became really the interagency oversight group for the county's collaborative management program. And then it basically functions to address and reduce duplication of services and fragmentation of services for multi-system involved families. So it's really a family-focused organization. That being said, that Heading Home serves more than just families. We really seek to address or respond to homelessness in all households in Jefferson County. So it has a number of committees that are listed here as well. So Heading Home is just one of those. So moving on to the regional homeless navigation model, this shows a timeline of sort of the inception and the initial ideas and discussion and the impetus for the creation of this model, dating all the way back to 2013. And my guess is even before that, there was dreams of having something like this in place. But all the way through 2020, when the municipal, is when we started hiring all the municipal navigators, and we've slowly onboarded all of the navigators. We have one more starting in Arvada on Monday, and then Wheat Ridge is in the process of hiring. So once we get the Wheat Ridge Golden Edgewater combined position hired, hopefully within the next month, we'll be fully staffed for the first time, which is extremely exciting. And then I'm going to kind of skim over this. John will speak more to this. He was really, Lakewood was very pivotal in the creation of this model, and getting that Lutheran space donated as well. But where we are today, as far as the navigation model, like I mentioned, we'll be fully staffed within a month with 7 homeless navigators. The navigators provide direct service to individuals in the county or in their respective jurisdiction who are experiencing homelessness. And then I'm on the team as well as the regional homeless coordinator, and I don't provide direct services. I really worked in this coordination capacity, trying to connect the dots with services, trying to connect what's happening in Jefferson County with larger resources in the metro area, et cetera, and really trying to organize and get more initiatives going here in Jefferson County. So what binds a team, what makes us a team, because we are all in different jurisdictions, which is a really unique model for a team, and what I really think makes it very successful. We do have a shared database, so all of the navigators that are not housed in PD will be using and are onboarding now with the Homeless Management Information System, HMIS. And the only exception to that, I should say, is with Lakewood, because the navigators housed in the police department, they're actually not allowed to enter directly into HMIS because it is a database that's shared with service providers throughout the metro area and state. But our goal is to bridge these two systems that Lakewood will be using, a system called Civic Core, and so that they'll be able to speak to each other, and we'll also be collecting similar data elements. So that will really allow us to give you quick, up-to-date data on not only what's happening with Lakewood, what services are being provided, the nature of the problem, and also, the solution as well, but give information on a countywide basis as well. So we also have weekly meetings. We meet as the navigators and myself to talk about what's happening, share information, problem solve, case conference. It's a really helpful meeting. We also bring on trainings and whatnot to on board. We also have a collaborative workspace at Lutheran Hospital that Lakewood was instrumental in securing, that they have donated free of charge to our navigation team. Unfortunately, it came online once COVID hit, and so we really haven't been able to utilize it much, but we're in the process of kind of figuring out a way that some of us can use it and share the space, just not all of us at the same time at this point. And then we have a workspace on Teams as well. So our key barrier, as in all issues of homelessness, is the barriers. There's not enough housing and the housing with services. And so that's a key goal that we have as part of the action plan, which I'll review shortly. So I'm informed weekly by what's happening on the ground with the navigators, and it's extremely helpful to my more system level work. Some of the initiatives we've been involved in the last couple of months to that end of addressing the shortage of affordable and supportive housing is we've completed the Permit Supportive Housing, PSH toolkit. And so that's kind of a training institute to train teams of organizations within a community that have a goal around creating more permanent supportive housing. And so we've completed that, come up with a project, and are actively exploring some potential sites. Built for Zero is an initiative that's been really successful through, I want to say it's up to 60 to 70 communities throughout the country. And it's kind of a systematic way to create goals around reducing homelessness and understand by creating lists of who is actually experiencing homelessness in your community, and assigning, making sure each person on that list has a case manager, a caseworker assigned to them that can navigate them to housing. And so it's really a systematic way to make sure no one slips through the cracks, and that we understand what the barriers are for every single individual. And it's a really client-centered way to go about it. And this initiative is behind many of the dramatic reductions in veterans homelessness in particular throughout the country. So we're launching that here in Jefferson County in the next month or two, which is really exciting. Foster Care Initiative is a partnership between Foothills Regional Housing and Jefferson County Human Services, which is kids and young adults aging out of foster care is a big, there's a high percentage of those individuals that are experiencing homelessness. And then we brought on some staff through Community First Foundation onto Metro Denver Homeless Initiative, which is MDHI, has hired staff specifically dedicated to Jefferson County to getting more of our homeless residents on what's called the One Home system, which is the system that's basically the queue to get in line for permanent supportive housing, metro-wide resources. So we're trying to just connect with different initiatives going on to get more people into housing and connect more of our residents with navigation, essentially. So the Homelessness Action Plan overview, here's the website to the actual plan. So I encourage you to review that when you get a chance. It's not one of those 25-page plans that will take you forever to read and is really jargony. We really tried to make it user-friendly and easy to read and review and understand. It is just the phase one of the plan. So you'll see there's a draft watermark across the page. So our goal is to finish that by the end of this year. And we're convening work groups and the Heading Home Committee to help get to that end. So basically the plan, the whole idea of the plan is to operationalize the goals of Heading Home, which is to make homelessness rare, brief, and one time only. So we've done that by identifying 5 objectives. I'll cover those briefly in the next slide. And then, also within the plan, we show a number of the statistics that we pulled together to identify these 5 objectives. And then it shows kind of the framework. We're using the objectives key results framework. So you'll notice in this plan that in its form now, we have the 5 objectives. We have a couple of key results underneath each one. And then by the end of the next phase, we'll have made some of those all the key results very measurable and identified the action steps under each one that'll accomplish these goals. So we want to keep it really simple so that it's actually achieved. And then, that's why we prioritize these 5 goals. So here are the 5 objectives that you can read in the plan. We are going to focus as a committee, as a Heading Home committee, on the first 3 objectives, and we'll be focusing on these by forming a work group around each objective. And so the work groups actually launch this coming Monday, and will be led in a logic model exercise by a Metro Denver Homeless Initiative to help build out those action steps that I just mentioned. So the three objectives are optimizing the crisis resolution system, increasing access to and supply of supportive housing units, and the third is decreasing barriers to persons seeking to exit homelessness. The last 2 are equally as important. I think a lot of the tasks and results in these 2 objectives can be folded into the work of the first 3, as well as they're very much a priority of all of the work that I'm doing. And so we'll kind of see what the participation looks like in these 3, and may launch these other 2 later on. But basically, objective 1 is really optimize the crisis resolution system. Sounds a little jargony. What I mean by that, and what we mean by that, is really to function a bit more like an emergency room, our crisis response system, meaning that it's a system that's willing and able to serve all persons. So regardless of the barriers, it assesses and prioritizes the most urgent needs, and it provides immediately relief and stabilization where needed, and then they triage to the appropriate professionals to work on the long-term stability. So it really functions so that it ensures that nobody falls through the cracks, which is currently what a major problem with our system is, that a lot of people, and particularly the people with the highest health needs and service needs, those are the folks that fall through the cracks. And so that's our real objective in this objective. Some of the examples of some things that we'll work on in this work group will be around development of appropriate and best practice sheltering models. Maybe it means a housing navigation center or alternative models, safe parking you may have heard of, that would fall in this group, street outreach, and then working with existing programs to help support them to lower their barriers to accessing the system, because that's another, we have a lot of programs serving the highest functioning populations, and so that's another, I think, goal in this. So the second one, increasing access to and supply of supportive housing units, that's a little more straightforward, but I just want to speak briefly to what supportive housing is. Supportive housing is very much a best practice model and very well-researched model for housing the most vulnerable chronically homeless individuals. So these are the individuals that you most frequently see on the streets. They're very visible. And supportive housing is just simply pairing housing with case management on site to help that person achieve stability in the housing. So the level of services is going to look different depending on the individual person. It should be very flexible to whoever it's serving. So it's a very cost-effective model. Again, it's been very well researched and documented to significantly lower public costs associated with the overuse of our crisis system, which is all publicly funded: hospitals, jails, shelters, law enforcement time, ambulances, all of those things. So I mentioned earlier our involvement in the Permanent Supportive Housing Toolkit, and that's a good example of where we're trying to get more supportive housing online. And the last one, I'll just touch briefly on decreasing barriers to persons seeking to exit homelessness. That's fairly more self-explanatory, and this could be more wide-ranging. So we're going to really assess what are those exact barriers. I think we know that folks, there's nowhere for someone to get a shower in Jeffco. If they need to get a shower, if they want to go to a job interview, they want to go to their mental health appointment or whatever. People need somewhere to put their stuff in a secure place and maybe get a shower. And so just basic, simple health and hygiene services need to be more accessible for one. I think supportive employment opportunities is another huge opportunity here in Jeffco. There's a number of fantastic programs that we can bring here to Jeffco. And a lot of folks have employment history, have been out for a while for whatever reason, usually health reasons, and need some support to go back into the system. And so we can bring those. And then there's a lot of also inherent barriers for folks that have a lot of criminal justice involvement in the past. And so we need to kind of reduce those barriers to getting for those folks to get housing. So those are the 5 main objectives. Again, I encourage you to read more in the plan about those if you're interested. And then I'll jump to severe weather. There's a 3-part plan this year to ensure that we have full coverage or near full coverage throughout the county. This isn't different than past years. We've always had a response for families with children, a response for adult-only households, and a response in our mountain communities. They'll be led by the same 3 agencies, essentially, as has been in the past, with families with children, human services, and then singles or adult-only households is led by Severe Weather Shelter Network. And then the mountain communities response is led by Evergreen Christian Outreach, which is a nonprofit in Evergreen. But the model is what looks a little different this year for each due to COVID. And the models for each are more expensive and will be paid for at least to the end of this year through CARES Act dollars, through county. And then families with children will continue to be funded by Jeffco Connections. I say cities here because at this point, it's extremely hard to predict what the demand will be for interventions in each of these sort of programs. So we're just going to have to wait and see. There may be a need to request funding from some of the cities. So I think we'll get a better sense of that once the severe weather starts, which I think should start probably this weekend. But the families with children continues to be a motel voucher program. And the singles this year, Severe Weather Shelter Network moved to a moteling option. And so they're typically have always operated out of churches. And so this year, because churches are a congregate arrangement, they'll be moving to a motel model and have hired staff to replace some of their volunteers that have been lost as a result of COVID. Because most of the volunteers are older and so not willing to participate this year. So, and I'll say all of these are very heavy involvement with several nonprofit provider partners to register and sign people up for these programs, Action Center being a large one. And then lastly, some of you are probably aware that we had a non-congregate shelter for our homeless residents throughout the county who were either symptomatic of COVID or were actually tested positive for COVID. That non-congregate shelter operated from, let's see, it was May through July, and was funded in part by Lakewood. So I want to thank Lakewood for funding part of that. It closed, the hotel wanted to open up for the public. Also demand, we really had that lull over the summer in folks experiencing homelessness that had COVID. So we're expecting, as it seems to be, there's another spike occurring now. So we've just recently, actually probably tomorrow, should be signed the IGA with Denver. And so that basically will have a 5-room block through the end of the year for Jeffco residents to use the Denver, they call it activated respite, but it's basically a hotel in Denver that it comes fully operated as a shelter and has medical and behavioral care on site. And it's so we'll have those rooms available to house our residents. After that point, it's hard to predict. Again, we're going to have to reassess what the need is at that point. And then we're also in the process of drafting an IGA with Boulder. They also have a different kind of setup, but a similar program to house homeless residents with COVID. And so they've agreed to enter into an agreement with us to house residents, so up to 10 Jeffco residents at a time, and that will be pay for use only, which is fantastic. So we'll have capacity when both Denver and Boulder is executed for 10 or 15 individuals. So we hope that we won't have more than 15 individuals with COVID that need housing through the end of the year. That should be, knock on wood, sufficient. So I'll stop there. Here's my contact information, and I'm happy to address any questions tonight or thereafter. And I know John and Amy are going to speak locally to Lakewood, but I just want to thank Lakewood in particular for being such a leader, and all of these initiatives really have been such a pivotal. Their staff work very closely with John and Amy. Their staff has been fantastic, and we couldn't be more appreciative of their collaborative nature of working with them.
Great. Thank you, Ms. Barker. That was a lot of great information. We will circle back. I think Ms. Hodson, do you want to continue with the presentation and then?
Yeah, I do. Thank you, Mayor, and thank you, Kelly. You can see that with this partnership, they have come a long way toward a coordinated response. It's never been this planned and this coordinated, which really helps everyone in the long run. So now we're going to focus more in our own neighborhood, look at our city and some of those efforts that are in partnership with the county. For the presentation this evening, we have Mark DeReza. He is one of the sergeants, one of the CAT sergeants. Then we have John Alish, another sergeant. So we have two sergeants of the CAT program. So Mark and John are both here to present. And I know you've seen John Alish numerous times. And then we have the infamous Amy Dieknicker, who is a principal planner, and she is the lead supervisor of the CDBG program. So this is, I'm really proud of the work that these folks have done. It's an interesting partnership between the police department and our planning department, and it works really well. So with that, we're gonna have a little transition from one PowerPoint to another. And as I'd indicated, I think last week, we've got a couple of videos that we're excited to show you. So I believe we're gonna start with Sergeant DeReza. So hang on tight while we transition. Oh, he's there. Hi,
There he is.
Mark.
Okay, can you hear me okay?
Welcome.
Yeah, we can.
Okay. All right. Well, thank you, Ms. Hodgson. Thank you, Mr. Mayor. Thank you, members of council, for having us with you tonight. We're going to kind of tag team this.
Yeah.
As John's going to have the PowerPoint up here in just a second here. Okay, can everybody see the PowerPoint there? Okay.
Yes.
All right. So I'll start out by giving just a little bit of an overview, kind of the last couple of years as far as what the city and a little more specifically what the police department has done to address some of the homelessness issues, and then we'll John and Amy will be able to fill in some of the gaps and get a little more detailed in some of that. So John, you want to go ahead and slide forward for me? Okay. So as at the police department, we've had a history of working with the community, forming partnerships to address problems, deal with problems in the city. Like I said, that started with our neighborhood action team, switched into our sector liaison unit. But again, it's kind of evolved over time. And back in 2017, Chief McCaskey and City Manager Kathy Hodgson realized that we needed to direct resources at dealing with some of these issues, specifically homelessness and mental health issues in the city. And fortunately, City Council was also involved in that and supportive of that for providing the financial backing for forming our community action team that we have now. So that's, again, this was back in 2017 that we started this. It was also during 2017 that we started our Jefferson Center for Mental Health co-responder, which I don't think we've brought up yet tonight, but again, that's part of some of the issues that we deal with in the community, and having that partnership with someone from, at the time, Jefferson Center for Mental Health, now just the Jefferson Center, having a person on site working with our team to address the issues of people that we interact with. So again, that started back in 2017. What I'll go ahead and we'll do now is we'll show you the video. It's going to give you an overview of our community action team. So we can get this going here.
Community action team is
Is anyone missing the sound?
Yeah, there's no sound.
Okay, should we have sound?
Yeah, we should. John, can you do something with the audio? For some reason, we're not getting any sound. And we can't lip read very well.
Yeah, I tried to pay someone to give me subtitles, but they didn't make it happen. So I guess let's see.
We had you for like a second.
And then it went away?
Yeah.
Oh, here we go. Share computer sound. That might do the trick. All right. Hold on now.
You might want to start over.
Yeah, well, yeah, you have to see more of me, though. So, all right, here we go.
My name is Sergeant John Alish. Many of you may already know me. I'm one of the two sergeants for the Community Action Team, and I'm responsible with my partner sergeant for ensuring that all of our CAT team members, including our 9 police agents and our soon-to-be 6 civilian members, have what they need to take care of you out there. The CAT team, or Community Action Team, is a group of police agents, civilians, and sergeants dedicated to finding innovative solutions to the problems that affect our community and their quality of life. And that includes all members of our community. We want to improve the quality of life of our residents, of those who come to work here, come to recreate here, and even those who are homeless and are currently trying to find a place to survive in our city. A CAT team person can be found under underpasses, talking to the homeless. They can be at the local hotel that's been having problems with crime rates, working with the manager to try and find solutions to the problems. They can be working between 2 neighbors who are struggling to get along or work together to remain peaceful with each other. CAT team members can be found on operations, working with other units. We've been working across the county previously, doing homeless counts, engaging in activities with other specialized units, and generally working in any way where we can, again, going back to that quality of life piece, find a way to improve quality of life for everyone. We're going to be there doing it. Homelessness is a big part of what we do, but we also focus heavily on mental health. We focus heavily on problem solving, crime prevention. We do a lot of work with our community as far as outreach efforts. You'll find us, we're the ones who are in charge of National Night Out every year. We engage in working with our fire department when they do fire muster. We attend anti-overdose campaigns. We work with our needle exchange programs, other things like that. So we're really the Swiss Army knife of policing, if you want to think of it that way. I think one thing that's neat about Lakewood is that Lakewood is a large area, 45 square miles, and every neighborhood in Lakewood's a little bit different and has different needs. But what's neat about us being that Swiss Army knife of policing units is that we can help every neighborhood. We can help every ward throughout the city. Up on Colfax, it may be working with the high crime rates and the heavy homeless population that's affecting quality of life, not only for the homeless people, but all the other people that live in the city and use the parks. Out on Green Mountain, it may be working with people on extensive car break-ins and crime prevention efforts to reduce that. It's working with our business partners in our business areas along the Union Corridor, the Alameda Corridor, and down in South Lakewood. So I would tell each of our wards, we're here for you when you need us. We're here for what you need. And if we don't have the answer, we'll find out who will, and we'll take care of you.
Okay, much more convincing with sound, John. Thank you for for taking care of that for us. So that gives you a little bit of a snapshot as far as our community action team. Again, there's a lot of different things that we do, but homelessness is certainly a focus. We're obviously not the only part of the police department that addresses homelessness issues, but we really are the one unit that really focuses on that on a daily basis. Going out there trying to solve those problems. So we'll talk a little bit about the Navigator model, and we'll let John dig into the details a little bit. But Kelly already alluded to this as well. But really, we recognized in the city as well as in the county that it's as much as we wanted to be able to solve all those problems and have our CAD agents take care of those things. We really needed some people that could specialize in that and help them get those resources that they need, take advantage of the things that are already out there, and be able to successfully navigate that system. So this coincided with the city and county leaders coming together and kind of settling on that Navigator model. And again, we'll talk a little bit more in detail about that here shortly. Okay, one of the things that we participated in with some other agencies in the county was trying to get a better idea of the population that we're dealing with. What's the real scope of the issue as far as homelessness in the county? And so by partnering with other agencies in the county, 2019 was the first regional homeless count that we were able to participate in to really get a good, accurate picture of the extent of the problem in the region. And again, this was one that I know John was very much involved in, and Amy for getting this thing up and running and coordinating this with all the agencies. But that was really a big landmark for us, and then just a good group effort for everybody in the county to get that good, accurate picture. And then finally, that kind of brings us up to where we are now. Really, I think what we pride ourselves on here in Lakewood is that it really has become a partnership working with the other departments within the city. We work with planning, with public works, with economic development, human resources, community resources. Everybody has participated and provided support in addressing these issues. And it really has, I think everybody's recognizing that it's not an issue that's going to come from us. We're not going to have a simple solution to the problem. And by everybody kind of stepping up and participating, that it's going to make us a lot more effective in trying to get these folks the assistance they need. So I think within the city, we've really seen that. We've also seen that in the county. And I know we've talked about some of the things we've done with the folks in the county, but it also involves community organizations, other stakeholders throughout the community, and really trying to involve them in coming up with solutions for these things. So with that, I'll pass this on to John and let him talk a little bit more about some of these in detail.
So yeah, hi, John Alish here, other sergeant for the community action team. It's good to see everyone again. We're going to begin with a Navigator video that some of you may have seen, but it's really good to see the navigators out in the field working alongside our agents and the police agents that Mark and I are fortunate enough to supervise. So we'll go ahead and show that, and then I'll kind of dip into how we got to where we are and why it all matters to today. So give me a second to queue up this video and we'll get started.
Hey man, I brought Matt with me. Hi Ed, how you doing? I figure we can make that connection now. I talked to you on the phone yesterday. Yes, sir.
My name is Matt Wallington, and I am a homeless navigator for the City of Lakewood's Police Department. As a navigator, I can step in. I have a list of resources, knowledge, connections, and things like that that I can make in real time to help people. Yeah. What else can we help you with today? Homelessness is a community issue. Homelessness affects everybody. And when we see people who are experiencing homelessness, it's the community that kind of also bears an imprint on that. And so when we can help people who are experiencing homelessness, we're also helping support the community as well.
Is there one thing that we can help with this situation here?
Not really, not unless you got a dumpster.
My name is Princess Griffin. I am the homeless navigator for the City of Lakewood. Every person is different. So when I come in contact with people experiencing homelessness, the first step is just to learn their story, to learn what they have to say. because as we know, everyone has a story. And then we go from there on how we can be of a better resource, how we can help those who are experiencing homelessness, what will be more helpful for them. And then I go back to my team and try to figure out how we can problem solve and figure out solutions for them.
There we go. There's a couple pairs of socks for them.
All right, we'll start with this.
When our agents find someone, they now have the ability to turn that situation over to our navigators, who will help case manage and identify solutions for that individual and what they need.
This is Princess. She's one of the homeless navigators I told you about.
How's it going? How are you feeling today?
Being on the CAT team, we've been exposed to a lot of our homeless throughout the city for a number of years now, so they're starting to get to know us, but there's still, police across our chest. And when you bring someone who's a civilian who just comes, a little softer, and it's just a nice approach for them to feel more comfortable. And on top of that, it just shows that we're willing to step out of some of those enforcement roles to really educate and really bring forth resources and, try to be ahead of the curve and bring those better resources to them.
I think it's important to know that the homeless community, or people experiencing homelessness, does have a voice, and I'm hoping to be that voice and to continue to be that voice. I think it's very important to kind of close that communication gap.
We have 9 police agents or police officers who are dedicated to helping the entire community, but especially our homeless population, and they don't have all the tools they need to do it successfully, whereas our specialized civilians who have the training, who have the experience, between our 2 homeless navigators, we have almost 2 decades of experience working directly with the homeless and providing services. And when we can bring that in combination with the energy, the drive to help that our agents have, we can really make a difference.
So what sounds like a plan? All right, good to see you, Ed.
All right, so I could tell you that video has been pretty well received, and it probably because we have amazing people who work here. I mean, I could tell you how proud Mark and I are of Princess and Matt, and really the things that they've been able to do. We're very fortunate to have them, probably the most professional police officers you could ever encounter, and to add a group that's just as dedicated but brings a different approach is just so wonderful to this team that we built. So I know many of you, I presented the navigation model to you, and we funded it, but we thought we'd go over again a little bit more of how it came to be, because I think beyond how we presented the nuts and bolts of it, what did we do and what did we accomplish? Because I think this is relevant to the discussion that we're having today. So in late 2017, before we came to you all, Jeffco city management and staff came together, and they really had that goal of identifying strategies to help those experiencing homelessness, right? We really sat down with the goal of, let's move the needle in a positive way. Let's not talk about homelessness. Let's not just, pay respects to the situation. Let's really try and make a difference. And so we were empowered. Amy and I came together, and we're very fortunate to work for an organization that really empowers its line level staff to go out there and make a difference. And so we came together, a very odd relationship, right? I've mentioned this before, a city planner and a police sergeant working together. And we spent many, many days in a small conference room on the planning side, just trying to figure out what to do. And I remember Amy and I had a conversation with Boulder County's homeless navigator, and she talked about it, not navigator, I'm sorry, coordinator, and she talked about all the things she was doing, and we got off the call and we agreed. We're like, wait a minute, we don't need more policymakers or policy advisors. We really need people, boots on the ground. We need to be down at the line level. We need civilians who can go with our CAT agents and bring all the resources they know about right down to the street level. And so that's what we proposed. And, Jefferson County actually, I guess, good work is copied, right? So Amy and I didn't magically come up with this on our own in our head, where Jefferson County had demonstrated great success with their navigator for homeless families. Her name's Yvette. She is awesome. If I could carbon copy 100 Yvettes, I would. She was the navigator under that CYLC that we talked about earlier. Some of her funding came from that to work with families. Well, what we know is in Lakewood, it's not just families, right? We have lots of homeless singles. And so we said, let's replicate this countywide for both singles and families. So now Lakewood has 2 full-time navigators. We brought one on in March and we brought one on in September. So Princess started with us in March and Matt joined us in September. And they work in partnership as Kelly discussed with that larger group. Well, let's talk about the encouraging start we've had. So keep in mind as we're talking about this, Princess was hired in March and then Matt started in September. So really we had 1 navigator for 5 of the 6 months we're discussing. And now we have 2. So you can only imagine how this is going to improve. We've had 14 people stabilized with motel vouchers. That the money for those vouchers is in great part due to the hard work Amy put together and you as a council in agreeing to bring it forward. So we'll talk about that. The next stat is what we're really proud of. 6 households signed leases. So that's not them couch surfing or living with their mom. That's them actually getting into a lease and getting housed. And that's huge. That's transformative change. That's something that we could really now see a difference for these families who now can raise their kids in a stable environment. And maybe the kids will go to school and stay in school because they know where they're coming home to every day. They're not getting pushed around in a car from place to place. That's people who now maybe will be able to get the alcohol treatment they need because they're stable and they're not living under a bridge. It's huge. And we're proud of it. We truly are, because that's special. We had 2 reunited with supportive services and family in another state. You know, when we started this, one thing we really tried to do is, you know, there's a history of cities, if you remember Salt Lake during the Olympics, pushing their homeless out, right? That's not the way we work. We only will help someone get to another place if we know we're putting them in a better place. So we will talk about some success stories with that. We just had another one tonight while we were waiting. While Kelly was presenting, I had Princess came back with Jen Doherty. They had just taken another gentleman who, if you've ever met him, he was the homeless gentleman with the beard who was kind of in the area between IHOP and like the Runner's Roost area. We're getting him back to Iowa with family. And we just got him on the bus tonight to Iowa. So that's what we're doing there, is that reunification with family. 3 shelter placements, 3 assisted with obtaining a housing voucher. So now that they have that voucher, we can work on getting them that long-term housing. And 1 sober living transitional program placement. And let us not forget all this during the COVID-19 pandemic. Let's talk about the comprehensive homeless count a little. So the yearly national homeless count, the point in time survey, it really lacks that comprehensive lens that we need. 1, it's held in January. And what do we know about homeless in January in Lakewood? There's a lot less of them there than there's in July, right? So that's one thing that was going against that count for us. 2, the count's 1 day, a 1-day snapshot. You're not going to see everyone who's homeless in Lakewood in 1 day, right? Additionally, it is only the literal homeless. So if someone is couch surfing or they're paying their way in a motel, but they don't have more than a few days to pay, they don't get counted as homeless. But we know that a lot of our motels are housing homeless people who are literally scraping by on what they make either at day labor jobs or from panhandling. So we came together, and Lakewood, along with 3 main co-chairs on this, said, let's do a comprehensive count. Let's really do it the best way we can. We know we're not going to be perfect, but let's try to do better. So we did that 30-day service provider survey that included hospitals, schools, mental health facilities, the Action Center, all these different places. And let's try and capture as many people we can that use services. And that's important because one thing we learn is that there's a lot of people who don't live in Lakewood who come to Lakewood for services. So we have to keep that in mind. And then we did that week-long street count, right? Lakewood staff created, planned, and supported the count. The amount of coolers we carried, if you say the word cooler around Amy or some of the others, the amount of water we transported, because this was in the middle of the summer. I know Amy's laughing right now. I can't see her on the screen, but I guarantee she's laughing. So we supported the count. Over that week, we had 200 volunteers. We went all the way from what I like to tell our partners in Westminster is, I thought it was Wyoming, but I found out it's Westminster. And we worked all the way down to Deckers in Jeffco. It took 2 hours for our volunteers and Jefferson County Sheriff's Office to drive to South Jeffco just to survey people on that last day. The CAT team was the lead law enforcement organization, and we had an average of 28 officers from all major municipalities in Jeffco participate, and including the Jefferson County Sheriff's Office. So now what we're going to do is I'm going to turn it over to Amy, who's going to discuss funding a little bit.
Thank you everyone for allowing us to be here tonight. I am Amy Dieknicker. I am a principal planner in the Comprehensive Planning and Research Division. And then I also manage the Community Development Block Grant Program for the city as well. So as John said, we've been working closely on all of these efforts for a number of years now. And in order to be effective, along with the navigators and the strong partnerships that we have, we also need to be able to respond to folks that are at risk of homelessness or experiencing homelessness through funding and resources. So over the past couple of years, we've worked really hard to leverage the available federal funding that we have and local partnerships as much as possible. In Lakewood, since in 2019 and in 2020, we've allocated about $130,000 to homeless activities and services. Unfortunately, with CDBG, we're limited in the amount of funds that we can actually allocate to specific services, direct homeless services. So we'll continue to allocate as much as we can while we pursue other funding sources to meet those needs. Earlier this year, we also obtained a grant from the Colorado Health Foundation. The $178,632 are helping to pay for our 2 homeless navigator positions, as well as some needed equipment for that program as well. And that was a great award. And then our CARES Act funds have done a lot of work, a lot of great things over the last just a couple of months. We have allocated just under $490,000 for rent and utility assistance to the Action Center just since May. We continue to see rent as the biggest need in the community so far. It's not going away. Rent assistance is absolutely crucial, and it's truly keeping people housed and preventing eviction and homelessness. So we will continue to do what we can to assist that need. Jeffco Human Services, as Kelly talked a little bit about, Lakewood partnered with them to help with the overall costs to manage and house those folks who were COVID positive or experiencing COVID issues that didn't have a safe and stable place to recover. So Lakewood used part of our CARES funds for that to help with our partnership there. And then we also directed funds to Metro West Housing Solutions to assist their residents directly with rent assistance. And the thought there was that we wanted to provide those households with a streamlined and easy process to work directly with their property management company, Metro West Housing Solutions, and really to reduce that large volume, unprecedented volume that the Action Center is experiencing right now with rent assistance. So we're trying to be strategic in how we were allocating those funds and getting them to folks as quickly as possible. I think I'm ready for the next slide. And then we've also developed some really wonderful in-kind partnerships. For instance, as Sergeant Alish described earlier, we're working with the county, other municipalities, and other local service providers. Last fall, Sergeant Alish and I kind of threw our hats in the ring and presented in front of Lutheran hospital staff in a mini Shark Tank event that they were providing to grant an award of $20,000 to address homelessness. They said, bring us your homeless ideas and we'll see if we can fund something for you up to $20,000. So we presented on behalf of the that Jeffco Navigator Model, and we were not only awarded the full $20,000, but we actually requested and were given office space at their Wheat Ridge medical campus for the Navigators to use as a centralized workspace. There they can work together, coordinate regularly, coordinate resources and organize trainings all together to really, again, make this a regional model that's effective and efficient. And unfortunately, as Kelly said, COVID kind of threw a wrench in our plans to get them all together, but someday they will be together and they will have a place to be. And then also, once we were granted that office space, the city of Golden stepped in and donated all of the furniture needed to house up to 10 navigators. We have desks, chairs. It was amazing, and they were wonderful to work with. This is a crucial piece to this whole plan. So we're really grateful for, because we didn't have a budget to furnish that workspace. And then lastly, again, as Kelly mentioned, the city did join other municipal partners, county, nonprofit, and housing developers to form a team for the Permanent Supportive Housing Toolkit program. This is actually a really great opportunity and program that is funded through the Division of Housing. It provides a series of 6 monthly, 2-day, very technical assistance and peer learning sessions that help these teams develop and figure out how to develop and foster permanent supportive housing in their communities. So we've been really working diligently with that team, and the actual toolkit is over at this point, but we are taking our ideas forward. We're actively engaging with an architect to take a look at a permanent supportive housing site in Jefferson County. And we do plan to keep that team kind of close together and continue to work on those opportunities for Lakewood and the county in general. Next slide. Homelessness has been identified as a priority, and funding has been approved for the Navigator program. So I won't go through the impressive list of accomplishments that Sergeant Alish already presented. I will touch on it though when I'm finished with this one slide. Just in the data that I have collected back again since May, we have 47 people that are 47 households that have been provided rent assistance and have prevented homelessness in our community. That's a really big accomplishment and is a big impact for our community in general. And then through the Permanent Supportive Housing Toolkit partnership, again, we'll continue to work with those partners and really start to look at opportunities where we can get that needed housing, both permanent supportive housing, as well as the entire the entire gamut of housing that's needed, transitional, emergency, and permanent supportive housing. Those are all needed in this community. And then I just wanted to kind of finish this piece by saying that every dollar that we have matters more now than it probably ever has. And we know that homelessness is expensive. It's estimated that it costs the community an average of $40,000 per year per homeless person. So I think it's really important to understand that in just 6 months, that 6 households have been housed. And the city has already seen, going from that $40,000 figure, with 6 households housed, we have already seen a very strong return of investment on the funding that we've put into these programs. And to Sergeant Alish's point, we need to create policies and programs that serve all of our citizens. And again, now more than ever, we need to be investing in smart, efficient, and effective strategies that will not only benefit perhaps for generations, a family experiencing homelessness, but also reduce the public cost to the entire community. And that's really what we're trying to do, and be really good stewards with these funds. So with that, I will turn it back over to Sergeant Alish.
All right, thanks, Amy. So I think, let's talk about challenges and barriers, because obviously we know homelessness is an issue, and we know that we've seen an increase in the visible homeless in Lakewood. We know we've seen an increase in these homeless hoarders and this chronic homelessness that gets a lot of calls across each of your desks. And it gets a lot of service requests to our desk, and it gets a lot of tough conversations at your ward meetings, at events. And so it's important that we're honest and authentic about what we're facing. And I think that that's key to this discussion tonight. And we'll go over some barriers, and then we'll go over some successes. And then we really do want to open up to a good discussion on this, because we believe that's really key. So we're all on the same page moving forward. So let's talk about challenges and barriers. One thing Lakewood Police, the CAT team, the whole city prides itself on is that quality of life for all, right? But it's a critical balance. We have to remember that the homeless are human beings with innate rights and worth, right? I mean, they're people. And oftentimes when we work with the situation, sometimes that element can be forgotten or it can be pushed aside, but we can't forget it. And that's one thing on our team we've really tried to do is remember who we're serving here. At the same time, the needs and concerns of our larger community can't be overlooked. One thing I like to say, when we did our homeless survey, we found out that about 460-ish homeless people live in Lakewood as of the time of the survey. That's 0.3% of Lakewood's population. So one thing I like to mention is, as we work on these issues, we can't forget the 99.7% of Lakewood citizens who want to use their parks safely, who want to walk down the street, all these things. So it's that balance, right? And how do we achieve that hard balance that each of you are expected to do as representatives, right? And so we'll talk about that. Well, first of all, there's no simple solutions. If there was a simple solution, you wouldn't be listening to me tonight. We'd just be all copying it, and we'd be going to bed early. There really aren't. And there's these legal limitations. Recent court rulings. When I started here 15 years ago, we had a really good set of panhandling ordinances. You couldn't panhandle in a private parking lot. You couldn't panhandle by an ATM. You couldn't panhandle by an RTD stop. And you couldn't panhandle in a way that impeded traffic, right? All really great ordinances. Well, there was a court case that knocked them all out. Ours very similarly mirrored Grand Junction. Grand Junction's ordinance got deemed unconstitutional, and ours went with it. Other court rulings surrounding camps, right? I mean, we have to look at no further than Denver. One thing we were getting ready to do, in all honesty, as a staff, we've been working on a collective set of recommended ordinance changes to help address some of these issues. And then Denver's camping ban, which had been upheld by the voters, was swiftly challenged by one judge. So now we're even dealing with things like, what is the definition of camping? And that's going through the courts right now, and we're watching it. So these court rulings, the legalities of this continue to mire us in kind of a struggle as we move forward. And I know I've had conversations with you, or you've had conversations with Mark or any of us as we discuss this. One thing we've seen more of lately, move into Lakewood a little bit, is a defiance and a disregard for authority. We've noticed that some of the homeless, and I'm not characterizing all of them, you have to remember it, some of them have really taken this kind of difficult attitude with us, where they say, no, I'm not going to do what you're asking, or no, I do not care about the people who are living in that house, So that's something we've started to deal with that's changed in the last few years. And we're trying to find ways. Now, what I can tell you is those who experience homelessness, especially the chronic homeless, classically, it takes 8 to 9 outreach efforts before they'll consider even working with someone who offers them services. And then we've seen that with some of the people we're working with. Team members of Mark's and I going out with Matt or Princess again and again and again. We're actually out there daily. I'm sure we'll talk about Morris Park tonight. We're out in Morris Park every day talking to them, because we don't have the option to give up. It's not an okay solution. One thing we want to come back to is criminalizing homelessness doesn't solve homelessness. That's one problem we've run into that we've really hit head on here. You can cite and arrest someone who's homeless as many times as you want, but eventually they're going to get out and eventually they're going to be back. And no amount of tickets, no amount of warrants will solve that problem. Lack of resources. Shelters, we don't have any specific emergency sheltering, right? That's why we had that presentation on the Severe Weather Shelter Network. There's nowhere in Lakewood that I, as a CAT agent, can say, I'm taking you here tonight because you have nowhere to stay and you might freeze, except for the hotel system that's been set up. There's no brick and mortar that I can walk up to. Housing. This is everything from transitional housing to affordable housing. I remember last time I presented, we got to listen and we had that discussion. Councilor Gutwein was talking about affordable housing and what are we doing to bring that forward. But also permanent supportive housing. Amy sings permanent supportive housing from the rooftops. It's so key because what it's saying is we know we can't just give someone an apartment and assume they're going to be okay. We need to provide them with those wraparound services, the counseling, the addiction treatment, all those things that's going to make them successful. And that's why we're doing that toolkit. And storage. Storage continues to be an issue. Storage is a difficult one though, because we know some of our homeless hoarders who have storage units. You wouldn't necessarily believe it, but we have one who has a 10-foot by 30-foot storage unit just filled with more stuff beyond the stuff that you see on the street. So balancing this, and answers are complicated. That comes to back to that no simple solutions. Mental and physical health. Oftentimes we will find that we need to take someone on a mental health hold, and that's a very high barrier. That's when they're literally in imminent danger to themselves or others. And we've seen them get out in 1 to 2 hours from the hospital. We had a case where we did that. We took someone on a mental health hold. We were still on the scene when they got out. And so some of the difficulties with the mental and physical health system we need to address. Substance addiction. That's why I'm so excited for that LEAD program we presented on a couple weeks ago. Because much like the Navigator program has changed the way we work with our homeless and opened up new doors, that LEAD program should get there. But we know that it's still an issue and we're not going to solve substance abuse overnight. To give you an idea of kind of what you have seen and to be true in stats is, so this is public homeless camps posted for cleanup by the city. So what this is when you call the CAT team about a camp at Morse Park or at 6th and Wads or 10th and Wads, you name it, we go out there and we post it for cleanup. So that's where we take one of our little yellow cards and we post it. And we say, you have 72 hours to clean this. If you don't, we're going to come in and clean it up, right? So in 2013, when we first started posting, we posted 8 in that year, 35 in 2014. Now come down to the last couple of years, 110 camps in 2019, and year to date, 106. So we're definitely going to surpass the 110. So what you all already know, we just want to put to a stat that you can see that definitely the public homeless camps have increased geometrically, in the years since we've been tracking it. Private and public camp postings. So this is another good thing to bring up. So we didn't generally track private postings, and I'll go over those in a minute. But so here's a 2-month snapshot from August 14th to October 14th. In that time, we posted 33 camps for cleanup on public property. What's important to note here is we've started tracking private property too, because private property, we don't hold the responsibility for cleaning it up. But one thing as CAT we did a couple of years ago is we realized we need to try and help our private property owners try and solve some of these problems before they get too entrenched. So what we do now is we have a green card, and that green paperwork says, instead of the yellow one that says you have 72 hours, you're on public property, on the green one it says, you're hereby notified you're on private property and that the private property owner can clean up your camp at any time. And you're hereby requested to move out within 24 hours. We've done 19 of those postings in 2 months. What makes private property more difficult is you have to find the property owner. So on public property, when a citizen says, hey, there's a big camp in the park, we can go out and say, we know that that's unlawful to be there after hours, so we're going to post it. With private property, we have to find out if the private property owner knows and if they're willing to prosecute, et cetera, et cetera. So there's a longer delay there. All this to say, and we'll get into questions, there's definitely some challenges. But I think what I want to end on for my piece is, because I never believe in being that kind of a Debbie Downer, is this. We have been gifted, and Mark and I and Amy, we all feel blessed that we have an organization that supports us and is willing to let us do what we need to do to make things happen. And remember when I said failure is not an option? That's really what I believe. So even though we talk about all these barriers, we are still going out to Morris Park every day and talking to these folks. We are still championing that a homeless person has inherent worth, and we cannot forget that we're serving people, and that we really need to raise up everyone. And we still are not forgetting that our community relies on the police department, the city, to make sure they have a safe place to go and take their family. And we're not giving up on that. And we can't. It's just, that's what we're here for. So talking about why we're here and what we're doing, I'm going to turn it back over to Mark, and he's going to discuss some of the hard fought successes we've had recently. And we'll go through those real quick.
All right. Thanks, John. So this is one we alluded to in one of the successes earlier, as far as some of the folks that we were able to get to a place where they had family and friends, had a support network, had services in place for them because they were struggling here. If you look at the map on the left-hand side of the screen, you'll see some of the places where they would set up camp, and they would occupy. Number one is up at Aviation Park. These were the folks for people who are familiar with the area, probably saw their camp at some point. It was a pretty large encampment kind of on the eastern side of the park, and get constant calls for service to address the issues with the camp there. Finally got them to move there. Then they moved down to the underpass at about 7th and Wadsworth, where basically the entire tunnel was taken up with all of their stuff. And then eventually they got cleared out of there and moved up to the old subway at 9th and Wadsworth, and they were basically camped out next to the old dumpster enclosure that was there. But by continually making contact with them, by trying to establish relationships with them, and then working with our homeless navigators, we eventually figured out that they had friends and family in Texas, and what they really needed to do is to get back into that support network and get down there. But it was going to be a struggle because they had so much stuff and so many things that they were holding on to. And then they also had other issues, like there's a restraining order that had to be dealt with, and some issues in court. And by addressing those barriers, and over time, we were able to pare them down from, like I said, an encampment that basically took up a tunnel that was the width of Wadsworth, down to what you see them carrying, and get them onto the bus. After we contacted friends, make sure they had a place to stay, after we made sure that the services were going to be in place for them when they got there. It's not just as simple as a bus ticket and send them on their way. It's to make sure that they're gonna find that better quality of life when they get there. At least have the things in place to try and help ensure that. This is one that we felt really proud of, because again, we've been dealing with them so consistently and over such a long period of time. It was nice to see them turn things around and get to a position that they were able to make that transition and get to a place where they're going to be more successful. So this was one, and from a human standpoint, it was nice to see that. But from a calls for service standpoint, that takes a lot of resources from us, obviously, and a lot of time for you folks to be dealing with those constant calls you're getting about these very high profile camps, when in reality it's two people. And if we're able to identify and address those core issues for those two people, again, hopefully we can keep them out of that position again, and move forward so that they can be successful, and we don't have to deal with this with these folks again, and we can redirect our resources towards somebody else. So this is one that we're real proud of with these folks here. John, can you bump us forward one? This is another one this is one that's in progress. For anybody who's familiar with Morse Park, you've seen the increase in folks that are experiencing homelessness that are occupying the pavilions, and in this case they basically set up tents. And the two primary folks that were involved here had been here for over a month, And we're getting calls daily from the neighbors, and we're trying to reach out to these folks and try and get them the help they need. Excuse me. Sean and Stacy, we'll call them by name only here, or first name only. Turns out they both have had some pretty significant health issues, and we're able to, by working with them, we're able to eventually get them to up to the hospital to be seen, and eventually we're able to get them to let go of a lot of the stuff that they've been storing there, and have actually gotten them both now into housing. At least I know one is at a shelter down in Denver that Matt, one of our navigators, was able to set up, and then I believe the other individual was in another supportive housing. So, and I haven't been up there in the last couple of days to see if anything's popped back up again, but as of the end of last week, this whole tented area had been cleared out of Morse Park. So again, for the people that live in that area, that's kind of a constant nagging reminder of the problems in the park there. Again, it's for us, we recognize the frustration for the neighbors, but at the same time, it's a long game for us. It's something we need to focus on. How can we just push them out of the park onto the sidewalk really doesn't solve that problem. Sometimes it takes a little bit longer to get those things taken care of, and this was a good example of making some good progress on that. And here's another one for some of our folks that are familiar with. They've probably seen this train of buggies out on the western part of Colfax, further out towards Quail Oak. He was parked along Sears for a while. This is one person. This is one person in his collection of things, and this is the one that John was talking about that also has a 30-foot storage unit that he stores the rest of his things that he values. We have been working with him very consistently over the last, probably the last 3-4 months. And by working diligently with our CAT agents, now with our homeless navigators, we got him down to, I think we were down to about 8 carts when he started with 22, 25, somewhere in there. So again, just helping him to get rid of some of those things, because he's a hoarder, but he's also homeless, right? So by being able to get rid of some of that stuff, get him pared down, we were eventually able to contact his mom. His mom lives in Florida, and she's willing to and interested in having him come live with her, and again, try and get him plugged back into a network where he has support and can hopefully try and get some of the services that he needs. And he's willing to do that. But again, this is one of those that we've got things we got little road bumps, or little roadblocks we have to kind of work through to try and make sure that we can get that to happen. But we've been seeing progress with that. So again, the problem hasn't been solved, but we're definitely seeing some progress being made. So I think if you look at the picture of the pickup truck, I think it's one of 3 or 4 loads. That's one of our CAT pickup, or it's our current CAT pickup that's operational that we use to help clean up these things. So that's just some of the hard work that goes into looking at these in a long-term solution and trying to get these folks plugged into some of those services they need. Because again, it's one guy, but we get multiple calls on him every day, and we have to, so we have to address those calls for service, because it's concerning for folks. But again, I think we're seeing some progress with some of these folks that we're willing to put in the time with to try and get them hooked up with these things. So on that note, it's kind of hard to see because we're socially distanced in this picture, but this is essentially our CAT team. So again, just to remind you, we have a daytime CAT team and an afternoon CAT team. John's got the day team, I have the afternoon team. We actually have 10 agent positions. 9 of those are filled right now. We have 2 Jefferson Center mental health corresponder positions. Again, they don't work for us, but they work with us. So they're a part of the team as well. And then our 2 homeless navigators there on the left side of the picture as well. And that's not, obviously we'll have some more folks coming in once we get the lead program up and running as well. So you can see that the city and the department really have taken a very serious stance on this, and we really do see the value in devoting these kind of resources to dealing with these sorts of problems. So on that, again, thanks for your time and letting us talk with you folks. And again, we'd like to open it up for discussion and try and address any questions, concerns, issues that you guys would like to raise.
Great. Thank you so much. powerful presentation, and certainly makes me proud. In fact, had a citizen send a text message just now to talk about how proud they are of everybody and what they're doing. And for some on council, this is a little bit of a repeat. We, for the community, so they know, we engage every quarter with all the cities in the county and kind of go over these different things. So I want to thank Kelly and Kat also, and I hope you can stay around for some questions. And kind of struck me right off the bat when Kelly said the key barrier, insufficient housing and service resources locally, right? It's certainly a challenge, but stuff that we are working on, and whether it's job training, job programs, affordable housing, it sounds like you've really covered all of that tonight and are really starting to make some serious inroads. So I'm super excited about that. No option, there's not an option to give up, and that certainly is meaningful. But the compassion shown is what Lakewood is all about. And I'll just close with this from my comments. I stumbled onto Brett on Oak Street, and I thought that was an encampment of 5 or 6 individuals, and that was all Brett. And had a chance to have a nice conversation with him, and the agents were on the phone with his mom while we were there. And Brett isn't from anywhere else. Brett grew up in North Denver and has a story, has a family, had a life, and this is now his life. And so I just give you so much credit for really digging in there. And as many know, it may not be fast enough. And when we might be able to get 2 moved, we may have 5 more come in. And had a gal the other day say, well, I want him out of here. I said, okay, we'll certainly, working with them. And I got word that one of those camps were going to move. And she said, well, where are they going to go? I said, well, they're just going to go to another part of the community. I mean, we don't necessarily have a place, and we don't warehouse people to just say you're going here. So those are my comments, but our board is lit up. So we're going to have some good conversation and questions. And I'll start with Ms. Vincent.
Thank you. Thank you, Mayor. I know I've talked to all of you a lot because Morris Park and 6th Avenue and 10th Avenue is all in Ward 2, along with all the homeless going up and down Colfax, primarily at the Walmarts. You know where they're at. So first of all, I really appreciate what you've done. Whenever I've called, you have immediately called me back, told me what you were doing about the situation and how you were working on it. I very much appreciate the fact that you said you have to pay attention to the 97.3%, whatever that was, because that's the pushback that I get. I want to walk in my park. The kids are scared. And I will just make a comment that I think most of those people seriously are compassionate, but it's where do they go and how do I deal with this in the limited capacity? And I get disturbed just on a personal basis when I get calls saying, I used to take the kids to Morris Park. I don't anymore. I now go to another park because I don't feel safe. I do have some specific questions. For the severe weather shelter, what I was familiar with on that before, because there was a place where they congregated in our area, and I mean that in a good way, where they knew it was a certain temperature, and they went there, and then they were there before the churches, et cetera, could pick them up and take them to where they go. So how do you identify those people now, and how do they get to where you're going to house them overnight?
So for severe weather, they are changing their model a bit this year. So they're not going to have those warming shelters, I think was what they called them previously, where folks gathered and then they were transported to the church. So this year they will be just like in years past, they'll folks that plan on using the severe weather shelter network resources, they need to register in advance, and that's a one-time only registration at one of a number of different providers, one of them being the Action Center. And then on the days that severe weather is activated, so the temperature is 32 degrees or colder and wet, or 20 degrees colder and dry, there's a number, and they have a website, and good communication system goes out that says, yes, it's declared today. They will report to, they'll actually go to a site. It's not a warming site, but it's actually outdoors because of COVID. They can't do the warming site. So they'll report to 2 different sites. I think one is Mile High Vineyard this year, and the other is Main Street Ministries, which is in Lakewood. And then they'll pick up the voucher, and they'll be provided with a bus ticket to go to. They'll be given a motel voucher, and they'll be told where to go and given a bus ticket, and then they'll go straight to that motel. And then the faith-based providers will be bringing dinner to them, a hot meal to them that night.
Okay. Can I ask another question? Okay, thank you. I guess there's 2. One comment too. Thank you for not putting all those folks on Colfax, because those families, they do not need to be on some of those hotels on Colfax at all. So I'm really grateful for that. I noticed that Archway Housing was not in any of these items and that got funding. Is that because it's not specifically in Lakewood? Because I know they have services for homeless, and we have a couple of them in our ward.
Well, I'm not sure. Which do you mean? They're not in any of the items that got funded?
Well, you talked specifically about Metro West getting funding, and you talked about some other places getting funding, but I didn't see Archway anywhere in there.
So for the Lakewood Cares dollars, Ms. Vincent, is that what you're asking about?
Specifically, probably, yes.
Okay.
Thank you.
Archway Housing was not provided direct funding, only because the way in which we were trying to strategically, basically Archway funding residents would probably go through the Action Center. We knew that Metro West has a pretty substantial amount of residents that are being housed in their properties. So we felt like that was, it made more sense to provide direct funding to them, so that they wouldn't need to refer their residents to the Action Center, and again, kind of reduce the volume that they were seeing through the Action Center.
Okay, thank you. And my last question, because I know everybody's got a lot. Has the Navigator program, has anybody else reached out to you to possibly replicate this? I know I've talked to people in Denver about it, and they say it's a great program, but I don't know if we're a model. So I do not know if you know if anybody else has reached out to replicate it.
From my perspective, no one's reached out yet to replicate. And we still haven't fully staffed it. So I think the evidence hasn't really come back to us yet. I think Lakewood was an early adopter, and they were, I think, the first to hire. So they are able to produce more data on the outcomes. But anecdotally, I've heard a lot of great, people are really excited about the model locally. I think Jeffco is unique in that we have so many municipalities. Like this model wouldn't necessarily apply to like Denver or a large metro area, but I think it's a really good model for suburban communities. And I think, as it grows and gets a little more time behind it, I think I predict that would happen for sure.
Okay.
And one reason Kelly's so vital, and this is kind of the next step, is Kelly's going to be talking to various public groups, right? So if we have a chance to talk at the state level about this, that's when we'll talk about that kind of thing. So hopefully it's still the best kept secret around, and we'll eventually we'll get the flooded requests in. So
I appreciate it. Thank you.
Okay, so I'm just going to go down my line here on the right. So I have Ms. Johnson, Gutwein, Springsteen, Harrison, Mr. LeBeer, Beta, and Abel. So Ms. Johnson, you're up.
Thank you. That was a very profound presentation. And John, you're one of my heroes anyway. Thank you for what you're doing. Actually, you're making miracles in people's lives. I have a couple questions. What is an average age of the homeless that are single? And also, are you finding many children on the street that whose parents are homeless and they're living on the street. And my last question was, recently I went to a meeting and one gentleman at the meeting told me that Denver police are instructed to send people west. Do you find that there's any merit to that sentence?
Sure. So in answer to your first question, from the comprehensive count that we did, and this is where it's so nice to have this because it gives us some more of that data that we've so needed for so long. So the most overwhelming age for Lakewood people experiencing homelessness is 25 to 64. So that would be considered just adults, and that's 67%. Young adults, so 18 to 24, is 7%, and then children under 18 is 16%, and then over that, seniors is 5%. So again, children 16%, young adults 7%, adults 67%, seniors 5%. One thing to keep in mind is with children, what we would be really concerned about is those households with only children. So you're like 15-year-olds and your 12-year-olds together with no parent. We surveyed none in Lakewood, 0%. So that's good news. Household with children was 86%. But also, unfortunately, that child that age is hard to get to come and survey. Just because they're generally not connected with services. Your best luck is like a school, if they have any interaction with school. So to answer your question about Denver, that we don't have any direct evidence that that's occurred. Denver and Lakewood actually get along really well, sharing a border. We as a county, I know, one thing that's great about this collaboration is Lakewood has more knowledge and input in the county than we ever have because of this great relationship we have with Kat, and with Kelly, and just being a part of the conversation now. And what we do know is Denver's reached out to us and said, hey, how can we collaborate better? We can't just silo ourselves between Denver and the suburbs anymore. We have to realize that people are moving back and forth. I can tell you that from talking to the homeless directly, a lot of them have moved out to the suburbs, especially with COVID going on and a lot of the civil unrest, because they feel safer out here. They've said Denver's gotten weird, as one guy put it. And they feel they receive a better level of service out here from their, from the police department and from others. So, everything that brings someone to want to live in our city is also what brings some homeless to want to stay in our city. But no, nothing specifically where Denver Sport has that as a policy currently by any stretch.
Okay, thank you.
Thank you, Ms. Johnson. Would you do me a favor and take your hand down too when you're done? All right, Ms. Gutwein.
Thank you, Mayor. Thank you to all the presenters. I know that, we've already said thank you, but I just also want to thank you. And I wish that every Lakewood resident could watch this presentation, because I feel like they would just be blown away with just the level of care and respect and humanity and compassion and innovation. And it's just really incredible. So we're so fortunate and proud of just all of your efforts. So thank you so much. I do also have a few questions. I guess the first question is just, I'm really glad to hear about everything that's planned for the emergency shelter network this winter. I just hearing how the program would work, I wonder if there's any way that people could be given vouchers almost in advance that could be activated just during the weather network, just because, are you worried about people being able to have transportation to get to Main Street Ministries in time, or is that not really a concern?
Yeah, I mean, it's the Severe Weather Shelter Network who's leading this. So they designed this model. I believe they're thinking, I mean, I guess we know we're registering everyone up, they are registering everyone in advance once, but not everyone that registers will request a voucher that evening. So I think there has to be some way for them to present and request a voucher. I think they toyed with the idea of doing so electronically or virtually, but it's a little difficult to do it all virtually. I think the demand would far exceed the supply of motel rooms that way. So, and they also are partnering with Stride. When people show up to request a voucher, Stride will be there to do a COVID test with them and also do a basic health assessment. And so if they should test positive, they're doing a rapid testing. If they should test positive, Severe Weather Shelter Network has a small number of medical vouchers set aside to house those folks, and they'll be put in a designated motel and probably given a few more nights stay and then given assistance and connection with Stride. So I think they have a whole complicated system of, at these voucher pickup sites. And then once they run out of vouchers, they have a number of supplies like sleeping bags and blankets and hand warmers and all those things, if there are no supplies, that they'll provide to anyone that shows up.
Great, thank you. The next questions I have are kind of just about looking forward and addressing some of the barriers and kind of long-term issues that we have in Lakewood and in Jeffco. And the first question is just, I guess just voicing a concern. I'm worried about once the rental assistance kind of dries up and once that funding dries up, kind of what we're going to be able to do. And I was wondering how much funding is left right now, or if it's all used up. And what I mean by that is I know it's already been allocated out to the different agencies like Action Center, but has it all already been used? And then kind of, and it may be this is probably the question everyone's working on is like, what are we going to do after that? So I
can answer that for you.
Yeah. Okay.
Or I can answer some of that for you. In terms of the funding that we provided with Action Center, I can speak towards so it was all CARES Act. Some of that was provided through the impact grant that was with I guess it was the county CARES funds. And then some of that rent assistance was also provided through the CDBG CARES Act funds. So I can speak to the CDBG portion. The Action Center has used almost all of that $120,000 that we provided in May. They are continuing to spend the additional funding that they have received from Lakewood, as well as all of the other, they also have received funding from the county as well. The portion of the Metro West Housing Solutions funding that was provided to them, the good thing with the CDBG CARES funds is that they have a longer period in which they can be used. So we're encouraging organizations that have different funding sources to use those funds that expire first, and then strategically our CDBG CARES funds have a period of 3 to 6 years, depending on when that grant period started. So for the Metro West portion, they've drawn down a small portion of funding for now because they do have some other funds that expire at the end of this year. So they're spending those down a little bit slower. The last thing I will say in terms of looking into the future, we are watching it very carefully. There was actually another round of CDBG funding that has been allocated to the city of Lakewood. It's might have been 2 or 3 weeks now, but HUD provided us a little over $700,000 in CDBG funds, and we are kind of holding on to that to see exactly what those needs are. Rent assistance is absolutely expected to be something that we will be responding to, and once we kind of move forward with that process and decide how those funds will be allocated, we will be needing to bring that towards council, because that will require another plan amendment like we did in May. So more to come on those funds.
Great. Well, that's really great to hear. And, I know that you all are looking ahead and planning, and I don't know as much as you do about what's going on. So I really appreciate that insight. And it's also helpful for us, I think, because one of the main goals that we set as a council when COVID hit was just advocacy and trying to kind of lobby for dollars that we can get and leverage all of our relationships that we have to work to get any additional funding. Okay, my last question for right now is another kind of broad topic, but I'm trying to learn and understand what the best practices are. Is having a homeless shelter, an emergency homeless shelter, still one of the best practices and still one of the goals? And if so, is it in some of the plans that you mentioned? And I read a number of studies, but I didn't actually read the draft that you mentioned tonight. I have it printed out. I'll read it. So are homeless shelters part of our goal? And then if not, is the model moving more towards doing vouchers and rental assistance and then just the supportive service housing?
Yeah, I think all of the above. We need all of the above. I don't think emergency shelter is a solution and an end. I think of a shelter more as an intervention, and to the extent shelter is connected with permanent housing is the extent to which it's effective in ending someone's experience of homelessness. So I think shelter is critical. The fact that we don't have a shelter, a place for somebody to get out of the elements and feel safe, that, you really need to feel safe to be able to achieve any kind of goal or, work. You have to be and have a feeling of safety. So I think it does provide that, and especially 24/7 shelter is really a best practice in sheltering. We've seen that it's not as effective, in particular in a lot of Denver shelters, those large shelters that make people leave at 5 a.m. and they can't come back till 7. Like, that's just, people are wandering out on the street and wondering where they're going to get food. It's not effective. So I think we do need shelter. We need a place for people to get safety and kind of calm down and bring their nervous system down while they explore housing and employment and all of those things. But we also need vouchers, and we need to make sure the shelter is effectively channeling people into housing.
Okay. I know every answer is really complicated, and it's like a puzzle, and you have to have all the pieces to the puzzle. And, and then we've talked, affordable housing, that's a major issue that we're dealing with, and that's something that, we as a council can have a little bit of more of an impact on. Well, that's really helpful. The question that I want to ask is, what would it take for Jeffco to open up a shelter? But I know that that's not really a question for you as much as for my colleagues and all of the, county commissioners and other cities. But I just wanted to make sure that is still kind of what we're shooting towards. So that was really helpful. Thank you all again so much for this incredible presentation and for the work that you do day in and day out. It's amazing. So thank you.
Ms. Springsteen, and then I have Ms. Harrison, then Mr. LeBear, Beta, and Abel.
Hi there. Thank you for your presentations tonight. So I'm an attorney, and I did some training before COVID to represent people in arraignments in Denver County for the Denver Municipal Public Defender. And as you can imagine, a lot of those people were homeless, had mental health issues. Some of them couldn't even afford a $5 bond, had nobody to call if they needed help trying to get out of jail. And so one of my questions for you kind of revolves around how that works in Lakewood, how many arrests of homeless occur, and whether people keep getting churned through the system in some way, and for what they're being arrested. That was one set of questions. A second set is, you talked about mental health holds, and that sometimes they would only last a couple hours, and sometimes you determine people are a danger to themselves or others. And so I'd like you to address your protocol for determining when that's the case, and if this is something where you call paramedics every time, how it could be that people are only on a hold for a couple of hours, and whether they get then charged with things afterwards, whether the term excited delirium comes into that picture. I just kind of want to know more about those kind of holds and what your protocol is. Also, along those lines, if there's any referrals for treatment, mental health treatment. And then finally, my understanding is that with the Lakewood Police Department, there is some kind of incentive for advancement with regard to the number of arrests you make in a certain area. And so I was wondering about if arrests of homeless people count toward those quotas for advancement. So those are my questions. Thank you.
Absolutely, Counselor. Oh, I'm sorry, City Manager, did you have something to say real quick?
No, I was going to ask you, Sergeant Alish, to answer those questions. So thank you.
Absolutely. So I'm kind of going to go backwards, since as far as incentives for arrest, there's no advancement procedure. When I was promoted to sergeant, there was no how many people have you arrested as part of that process. What we do look at is what kind of effect are we making in the community, as far as if we have a high crime area, are we helping address that? And whether that be through arrests of people who are breaking into cars, absolutely. But homelessness is not one of those areas where we focus on arrest stats. I can tell you that our chief is fully behind the CAT team, and he reviewed this presentation, and that presentation includes criminalizing homelessness does not solve homelessness. He fully believes that and agrees with that. We can't arrest our way out of the homeless problem. That's not going to solve it for anyone. So I can tell you that first. Let's talk about the mental health piece that you just brought up. So the standard is law enforcement officers are one of a very select group who can determine if someone is a danger to themselves or others and place them on a mental health hold. The only other groups that can are practicing clinical social worker, psychiatrists, or people who work for JCMH, for example, or doctors themselves. but that's vested with us. And the majority of those cases where we would do that are cases where someone has attempted to commit suicide or has threatened to commit suicide or made homicidal statements, right? Saying, I feel like the voices in my head are telling me to go hurt someone, that kind of thing. The difficult cases that we deal with, especially on the CAT team, are those cases where it's someone who's so mentally ill, they're disconnected from reality, but there's no real answer to the problem, right? It's like, okay, so they literally are disconnected from reality. And usually what ends up happening, Councilwoman, is that they may get to the point where they're walking in traffic or they're talking to people that aren't there. And we end up taking them on a mental health hold because their mental illness has made themselves a danger to themselves simply because they cannot care for themselves in a meaningful fashion. Or they are paranoid to the point where they believe their neighbor is gassing their house and they're taking actions against that. They're putting up plywood on their fencing to try and avoid the gas coming over. And they've filled their house with saran wrap and they've brought themselves in. Those are the cases where we're trying to get them the mental health help they need, and they're quite often released. And then going back to your first question, do you mind just touching on that again, the first piece of what you were, the defense and $5 bonds and what are we doing about homelessness? That's one area where I'm most proud and we're doing it differently. So if you remember, Sergeant Teresa mentioned how there was a restraining order with Candace and Perry. That's a very unique case because they had a restraining order that was based on a domestic violence from a long time prior. And every time they would be seen together, they would get rearrested, but that wasn't helping anything. And so we actually went to the city attorneys and we talked to them about it. And they agreed, can we get this restraining order modified to allow contact? So they're not getting rearrested with new charges all the time for conduct that we know they're going to do anyway. And they agreed, and we were able to get that modified. We will often deal with the fact, as I'm sure you saw when you were doing these bond hearings, you have people who experience homelessness who have 15, 20 pending cases against them. That's a huge barrier to getting housing, right? If you can't make it through your 15 criminal cases, how are you supposed to get anywhere you need to be? So our team is really dedicated to dealing with those barriers. We will go, and that's where we can have such great input, is we can go meet with the DA's office and say, hey, I know they have these 10 cases, but they've really started to show some improvement finally. Would you be willing to compartmentalize those into one misdemeanor case? And if they agree to some terms with their plea deal and we can get them the help, would that be helpful? That's what we're really trying to do now. And that's why we're trying to be smarter about enforcement too, because we know adding one more charge for being in the park after hours or open container doesn't help them move their way towards finding stable housing. So really we're recognizing there's times and places for enforcement. As we talked about, we're not going to forego public safety to the benefit of one person. But there's times where, kind of like we're doing with that LEAD program, where we can forego the open container ticket if they're willing to work with us. And we can forego some of these other charges. Does that answer most of your questions, or is there anything else I can add?
Well, could you go into a little further, specifically the protocol for determining that somebody is a mental health hold, that they're a danger to themselves or others? What is the protocol for determining that within the policy?
Sure. And I think that's something that if we need to discuss further, that gets into a whole nother avenue of mental health work that's probably outside the scope of this study session. But I can at least get you the basics and always get back to you on what our policy is. Suffice it to say in summary, when we engage with someone who's exhibiting mental health symptoms, we are looking to see if they're an imminent danger to themselves or others. And we look at a bunch of different criteria. Have they made statements in support of that? Have they engaged in activity in support of that? Like I said, have they been walking in traffic? Or have they posted on their social media, I won't see another day, and their mother calls in and says, I read this, I'm really nervous because my daughter's been depressed. How do we need to handle this? So we look at the immediacy of it. And ultimately, what we're trying to do is say, okay, is this immediate that if we take no action, they or another person will get hurt or could get hurt? And that's when we make that decision to hold. with that understanding, we're trying to get smarter about it. That's why we have our co-responders, right? Holds aren't always the answer. Sometimes it's working with that person and getting them plugged into those services. Many of you know a famous hoarder that is in a ward that some of you are in, where her house is packed to the gills. We took out our co-responder and one of our CAT agents weekly and had hour-long sessions with her, trying to get to a solution, right? Because we know a hold isn't going to change anything. So it's trying to do that. So in answer to your question, Counselor, as you said, I think there's criteria we follow. It's actually written in the statute of what we can and can't do. We are very careful about when we use those holds, because we treat them to the same level of the standards of arrest, because we're taking someone against their will. So we're very careful that we do that in a way that we can support it through documentation. But that's not always the answer. And that's what our teams tried to change and say, wait a minute, can we do it differently? Because we know this cycle doesn't work. Can we get the mental health professionals into the field with us to start doing some field outreach and some field therapy? Because sometimes you can't even get them in the door of a mental health facility. So what can we do to kind of move that forward? Is that good enough for now, at least?
Sorry, this mute button. Yeah, and I would love to have more conversations about that with you all. Thank you.
All right, so now we have Ms. Harrison, then Mr. LeBeer, B to Abel, then Ms. Franks.
Hallelujah. All I can say is, wow, you guys are doing such a great job. And I really want to thank you for all you do. It really makes a big difference. And I would also echo what a lot of other counselors have said. You've been very good about responding very quickly and letting us know what's going on, in our wards. So thank you, thank you, thank you. There's just one thing I wish we could figure out how to do, and I don't know how to do this. Counselor Vincent talked about a lot of families don't want their children around in parks where the homeless are because they're worried about the safety. And like you said, a lot of these people are just probably people down on their luck and are just as safe as grandma and grandpa that have the kids at the park. But that's one, I wish there was a magic wand where we could put a sign on their face that says, I'm safe, come say hi. I know that's not possible, but I think that's really the big concern is we don't know their status. We don't know if they're violent or are they just big teddy bears. And I wish that there was a way we could do that. So whenever you get a magic wand, that's the thing I want you to do. The other thing I would ask is, what are you expecting in terms of when the cold weather arrives? Do you see decrease in homelessness? Because I'm thinking maybe I'll call them volunteer campers, would that be the way to describe it, might go to other places, and then the true homeless are here. Tell me what you see.
So we always see a decrease in homelessness in the winter. It's just kind of a given. It will be interesting to see what happens this year, though, because I fear that COVID and, like I said, some of those realities in downtown may have changed that. Also, we have to remember too, co-located sheltering is difficult right now. Denver shelters are not operating at the same capacity they were, and non-congregate sheltering is very expensive. And that's what we're seeing with this severe weather shelter network, and answering the call really, and luckily us as a community answering the call financially to back it up. So this year may be different than others. I think what will be interesting to see is, two things. One is what's the makeup of who's remaining here? How will that have changed? And what do we do to support them? And I can tell you, for the first time in years, well, frankly, ever, the beautiful thing about this collaboration we've developed is we're part of the conversation now. We're very fortunate to have Kat and Kelly call us and say, can you talk about this with us? Because then we're part of that conversation. We're able to have input. When you mentioned sheltering the families and stuff, we had input on where they should look at the hotels, that we never did that before. So with this new group, and where we're going, I think to answer, we will see what the change is compared to years past. We're fortunate to have the shelter system, and then we're fortunate to have a good group because Kat and I actually, we'll never forget this night when the bomb cyclone happened. Kat team ended up with a van, and Kat was on the phone, and we were working until like 10 or 11 at night finding housing and getting people downtown. So you'll have that same ingenuity, that same safety net as our years past. I just don't know what we're going to see, in all honesty. We'll definitely see a decrease as we always do, but I don't know how substantial that decrease will be.
Thank you. And then my third question would be, with the COVID influence on shelters, I'm thinking a true shelter where people would be having rooms together, kind of like, is probably an improbability for this year at all. Working toward that, by all means, but given the circumstance of the way COVID's being passed around to all levels of society right now, I'm thinking that, a regular shelter, they're probably safer in individual hotel rooms than they would be necessarily in a group of people, because you never know who has it and who doesn't. So my thought for the day. Thank you.
Yep, that's why the Severe Weather Shelter Network had to set that up, and it's been such a lift because we recognize that co-located sheltering will not work this fall for anyone. And that's why Denver's bed count is reduced, because they've had to decompress those spaces and ensure social distancing within the space. So it's a brave new world for all of us. We're very fortunate that we have the care sellers to support us through the end of the year in that endeavor. So
that's great. Thank you for all you do.
Mr. LeBeer.
Hey, thank you, Mayor. And thanks to all of our staff who are working on this issue. I know this is a tough issue because obviously it crosses a lot of, different departments and a lot of different elements of our city and county and state governments and federal government. It's certainly a challenge for elected officials too. I think it's hard to have a good sense of what the needs are, what resources are needed, and who to ask for what, and which will lead into some of my just sort of comments. But one question I had is, I'm just wondering what kind of data, we're tracking. I know we got a little taste of it, I think, Sergeant Alish. And so I'm kind of curious, because I think it's going to lead to my ultimate observation, which is what I think council needs a little bit of marching orders. I think we need a sense of what we need to be asking for, what we need to be lobbying for. For example, I sat down with Senator Gardner earlier in the year and had an opportunity to talk to him about CDBG funds. And we know that there are some restrictions on the way we utilize CDBG funds. That's something that, had I had that information at the time, that might be something we could start having those conversations about. And then obviously, so lobbying, I think, is one element. We have a representative who serves on the CML board. We have Dr. Cog. We have, NLC. We have all these resources. I think if we have some good direction and a sense of what the needs are, we can help really support all of you and getting you the resources and whatnot that we need. To that point, I think obviously good data, a good sense of what we're buying and what we're getting for the resources we're expending, obviously, that all I think is helpful. So the kind of things that came to my mind just while you were talking was just sort of things like, are we getting people signed up for food stamps with the county, or, are we getting, obviously there's lists for affordable housing for HUD and whatnot, how many people are we getting signed up to those things? Maybe Medicaid, there's a whole long list of things that obviously resources that are out there. So vouchers, do we have enough vouchers? How many people are we turning away from vouchers? So those are kind of questions that are coming up. One question I did have too, is our voucher program, is that just directly through our police department, or are we, I know the county operates a voucher system, so are we just supplementing their stuff, or how does that work?
So what we've tried to do, it's a delicate balance because the Lakewood Police Department is not a social service agency. We're a public safety entity. So we have to find that balance, right? So that's why our navigators are kind of the perfect angle for that. So to your first point, our navigators are the ones who know all about Medicaid funding, food stamps, VA benefits, right? There's a ton of VA benefits that veterans don't even know about. When we plug them in, they're one of the easiest to get housed because there's the benefits there. So our navigators are there for that. For the vouchering, what we've done is emergency immediate vouchering, we're having our navigators help with, right? So if we have a case we're working on, we'll do it. For the long-term vouchering, for the severe weather shelter network vouchering, that's still occurring through the county and through those service agency partners, because we need to make sure that they're plugged in and they have a role. We don't want the police department or the city of Lakewood to try and take over or be in place of the Action Center or the Jefferson County Human Services or any of these groups, because in the case of the Action Center and all these other agencies, there's been good funding dollars that have gone to them to support just that. So we have to make sure that we're not subverting or undercutting that. So the long answer to that is what we did and what Amy and this group and staff allowed us to do was say, let's take our CDBG dollars, let's make sure that we can address things quickly and be that first 2 weeks if we need to, and then let's see where we can turn it over from there. Now we've gone longer than that, especially with COVID, and luckily we can do that with CARES dollars, but we really kind of take them as they come, but we make sure that for the public face of it, it still goes through those service agencies as it should. Because we don't have the capacity to take on all that as a city. So I don't know if Kelly or Amy or anyone wants to add anything to that. That's at least operationally what we do. So
I think, John, what I would add is that as a county and as all the city partners through this coordination, one of the things I think we've really enhanced over the last couple of years is that coordination to make sure that we are leveraging the funds from the various sources appropriately, including housing vouchers and motel vouchers. So I think we're doing a much better job of that. And earlier there was assistance along with the food calls that happen every week. There's also a rental assistance call that happens every week that is an effort to coordinate all of this and make sure that we're aligning everything properly and serving the community the best way we can.
Got it. Well, thank you all for that. And then I guess my last comment is sort of on the data thing, but it's a little beyond that. It's like once we have the data, I think we need, targets as a city, but also the surrounding cities. I think if we sort of have a NATO approach to this, where we're all sort of sharing resources, and I think if we all kind of know, what that is and how we can be supportive of us and the surrounding cities in the county, and we have some sort of target, that's obviously something we can push for as a council, but we can also work with our colleagues in other cities like Arvada or Wheat Ridge or whatever to help increase their resources. We could all work together to get some dollars in one place so we can do some good. And I know, and I don't know how, I know I've seen other cities like Fort Collins. I know they have an annual appropriation, for example, of spending that helps support homelessness. So that's the sort of thing that, I'm looking at for Lakewood that I think would be helpful, is making sure that we have some sort of, set resources to help out with funding for vouchers or other supportive services that we can help with. And be good to get a sense of how some of the other cities that are similarly designed and similar plight, how they might be doing things so we can learn from their experiences. But appreciate all this. There's a lot to chew on. And I think council, I think we'll need to dig in more and learn more about this to really see how else we can be helpful. But if we can get any more information on what our role could be to be better advocates for our community, that would be helpful. Thanks.
All right, so I have Mr. Beta, Mr. Abel, then Ms. Frank.
Okay, thank you, Mayor. Sergeant, I don't have any questions and I don't have a whole lot to add except for one thing, and that is that you and your team have taken the notion of service and protect to a whole new level. You've taken police work to a whole new level. I can see and hear the pride in your voices and the pride in your faces, and you make Lakewood proud. So thank you very much. We will do whatever we can as a council to support you, and please keep up the good work. Thanks.
Thank you, sir. Mr. Abel?
Thank you, Mayor. First, let me tell you folks, you have a tough job and it tears at your heart, and I know it's difficult sometimes to go to work and deal with some of these issues. I worked for juvenile probation in Houston for a short while I was in school. It was the toughest couple of years of my life. I can't imagine having to deal with it year after year after year. But so you're strong people, and you deserve our total respect. One of my concerns goes to that issue, though, the hidden homeless. Every time I talk to a principal in one of our high schools, especially the alternative high schools, I hear about kids who are 16, 17, 18 years old, and they can't live at home anymore. Are we reaching out to principals and other school district officials to identify these folks and give them a hand up? And there was a young man who, when my son was in high school, he spent an awful lot of time staying overnight, or 2 or 3 nights, sometimes a week, at my house. And his father wouldn't let him live at home. But every time he would be found out after in the middle of the night, somewhere he shouldn't be, sleeping between a couple of buildings, they would take him home. And it never did any good. It made things worse. So what do we do to identify those kids? And how do they get help if they're not old enough to speak for themselves or to apply for the benefits that an adult person could try to get to help them along?
I can certainly just start, and then others can chime in. I will say that I think the navigators and the county overall work very closely with the Jefferson County School District and the Homeless Liaison Program. We're very well coordinated and connected with them to identify exactly those kids. Services are tricky. The school district could speak better to exactly the regulations that they have to follow, but there are many programs that can help support those families and those students in finding the services that are most appropriate. I will say this is a case that in Denver, we tend to find more resources. And it's not that there aren't a lot of people here in Jefferson County trying. It's just that it is tricky serving those underage students that are do not have older people that are taking care of them. We do, in the county, we run programs that are around that employment and training piece. So we can get kids that are experiencing homelessness and get them either reconnected to school or get them into training and housing programs that will support them. Kelly mentioned briefly the foster care program that is a partnership with Foothills Housing, formerly Jeffco Housing, and the CASA program in Human Services. And that's exactly what that is kids who are emancipating out but are still under 18. How do we support them with more permanent housing and training and education programs that will help them with employment? So there's more that goes into it, but I think you're accurate in that there is a gap there. And there's a lot of entities trying to resolve that and make sure that we don't lose hold of those kids and still give them a pathway to opportunity.
I will add operationally that one of the hardest things is to track and count them. We worked very hard with the comprehensive count to engage with the school district to count kids that were homeless. But the problem is the school district is a whole nother animal, and they were very supportive of the idea, but they had just gone through a database change, and there's tons of privacy and protection acts associated with kids, especially kids underage. And so navigating that world is difficult. if we do the count again, I think we'll be more successful in getting them engaged, because like I said, a lot of it was timing. They went through an update on their system and it totally messed up with our count. I think to Kat's point, and what I'm trying to say though, that's why it's so important to have a good safety net. And that's why it's good that we have these navigators now and this group to kind of catch those kids as they come through. Our juvenile crimes team and our juvenile crime sergeant is very connected and is not afraid to call Kat if they identify a kid who needs help. And so that's been so good. Whether it's a kid that does have a parent, we've had them come down and say, hey, dad's not great, but he's all this kid's got, but they're homeless, can you help? But also these kids. And so I think that's the importance of having this group together, so that we can say, because we often know that cops are the ones who find people after hours, right? They're the ones who get the call of the kid sitting on the stoop at 2 a.m. and no one knows why he's there. So just having that avenue now where our agents can leave a voicemail for us, because it's not child abuse, right? That's the problem, is it's not criminal, but they can at least leave a message and say, hey, I ran into this kid, seemed like a good kid. He was sleeping alone. Can you see if you can do anything? That's the setup that we've made. So it's a very good thing to have it so embedded in our emergency services, because that's who usually finds them. And so that will bode well for us in the future.
Thank you.
Thank you. Ms. Franks.
Thanks, Mayor Paul. Certainly, most of the questions have been asked before. I think actually all of them have. I just wanted to certainly thank everybody who presented and all the information, and also wanted to thank the city manager, who is always good at reminding us when the quarterly meetings are, because much of the information that was covered tonight was covered in that last meeting. So it gave me the opportunity to read all the reports and to be really educated, and also to be able to include information in our newsletter to share with our community. So I certainly wanted to thank her for that. And to our sergeants and all the police agents, I wanted to thank you for the kindness and the compassion. I have family members who suffer from hoarding, and how respectfully that you treat those possessions may not seem valuable to some of us, but they're very valuable to them. So I just wanted to thank you for treating everybody so respectfully and so kindly, as you help them also shed some of those things that are keeping them from moving forward. And finally, had a lot of outreach from the community about how they can help. Many people don't feel comfortable volunteering, and just wanted to remind people that in December, early December, Colorado Gives Day, a lot of our, agencies like the Action Center, financial donations are very welcome. If you've got an employer who does employee matching, we know there's a huge need out in the community. Last time I campaigned, and the first time I campaigned, when you knock on doors and someone opens it, you often can see the poverty that exists behind the door. And so I think it's just important, if you're have financial means, maybe find a way to contribute to one of these agencies who can put those dollars to good use. And so mostly all just comments, but thank you all for your time.
All right. Okay. Well, that was very, very great. Good questions and comments, good dialogue. There are two things I wanted to touch up on real quick. One is, this is also, not only is this a Jefferson County approach, but the Metro mayors have also taken this on in conjunction with the Denver Foundation. And you heard mention the Metro Denver Homeless Initiative, which there is a flex fund, which I think we got almost every city and Metro mayors to put something into that. And that provides some rental assistance, kind of that small gap that might be keeping somebody from being out on the street. And so that is certainly available. And, this is a priority. And prior to COVID, the governor actually hosted a roundtable on how the state could better engage. So I think these conversations are going to continue to evolve and hopefully move forward. And that's where us as policymakers can really work with our commissioners, our state delegation, and even the governor to say, how can we all work together? Because this problem is in Grand Junction, it's in Brush, it's in Lakewood, it's in Denver, it's everywhere. And so we need to continue to work that route. I know COVID has been challenging for showers for folks. And I also know that some cities have looked at locker programs or things where people can keep their stuff and keep it safe and secure and dry. And I don't know, we don't, it's getting late. We don't have to go completely into that, but I know those are things that I hear from the community. And Bethlehem Lutheran had the beautiful shower trailer, and I think they've probably struggled with that with COVID. And so I don't know if we have any answers to that at this point, or we're working towards different things, but that is certainly on people's mind. Kat, I see you smiling. I don't know if you have an answer for that.
Well, it's probably not the best answer yet, but I will say that the county and the cities have been working really hard on that. I think what our emergency teams in the county have identified is that there's really only one shower truck for the entire Metro Denver area available. And so the reality of us securing that is very slim. And so what we've been exploring, and Kelly's been a little bit involved in this, is looking at possibly recreation centers that would contract with us to basically lease out their shower space. That I think will take a little bit more support from leadership throughout the cities and the county to make that possible. There have been some rec centers that have expressed some interest, but I think then they also have some other concerns. Right now we do have CARES Act dollars that we can use and we're ready to deploy. But at this point we don't have a specific rec center that has said, yes, we're definitely in, but we think that it is probably the safest option for our community, given the public health situation that we're in right now. So that's kind of where we're at with exploring that option. But you're right, it's a constant conversation and a need.
Okay, thank you. And Sergeant, do you have we have sergeants on, do we have any ideas as far as lockers or safe places for people to kind of keep in? And that's what we've heard from the communities that are mainly impacted, is they understand that they're their neighbors, but they get concerned about all the stuff that comes with being neighbors on the street, and how can we better manage that?
Yeah, so Mayor, I think that's something we've been having discussions on. We had that discussion. Going back to Mount Air Park, where we have the community garden, they were asking, hey, could we put some storage units on the side of our garden? And then I started to talk to them. I said, what's the plan if you have a vermin outbreak associated with it right next to your garden? What's the plan if you have needles there? And quickly the gravity and the weight of that discussion kind of showed through, right? So we're trying to be smart about this. We've been throwing around some ideas about one thing, and again, this is very kind of initial discussion, but one thing we've liked about the Severe Weather Shelter Network is the way they were kind of mobile, and how they didn't make a homeless service occupy one area, because then you would avoid detrimentally impacting that area. So one thing we were considering is mobile storage, where it wouldn't be that you could throw your backpack in there, but maybe you could throw a few things in and say, can you keep this safe for me for 2 weeks while I go do X or I do Y? I can keep the backpack on me, but I want someone to store my valuables. So that's one thing we're discussing, is like a mobile storage option, where it wouldn't have an address. So you avoid some of those issues with congregating around it, or the NIMBYism associated with, well, I'm fine with that as long as it's not within 2 miles of my house kind of mentality. So that's really some of the stuff we're looking at right now. I know as a member of the Action Center board, we've discussed it as well, what the Action Center could do from that avenue. But again, it comes back to all those questions surrounding staffing and all that. So
no easy answers or solutions. Well, thank you. We do have a public input portion, and so it looks like we have a couple folks in the queue. So let's go ahead and do that, Madam Clerk. And for our folks who are going to speak, if you please just give us your name, address, or ward, and I'll start your 3 minutes, and then let you know when you have 30 seconds left.
First one is Eric Brent.
Okay.
Hi there, can you hear me now?
Yes, sir.
Hi, first of all, I have quite a number of people watching my restream of your meeting, and there were a number of people that wanted to speak the last time, and you said that there was nobody in the queue. And I know for a fact that people are dialing in, and so maybe if the mayor would remind these people that they have to press *9 to raise their hand to speak. Maybe they didn't know to do that. And if they get picked to speak, that they have to press *6 to unmute themselves. If you'd please remind people of that. I would just like to recognize a woman in your community by the name of Janet Matson. Janet Matson lives near Estes Street in Colfax, and out of her tiny little kitchen, she feeds 50 to 100 homeless people every single Sunday, and she has done it in that tiny little kitchen on the 16th Street Mall since 2012, every single week. So I think you need to encourage and recognize these people in your community that are doing this, because Janet's Kitchen has been feeding those people for 8 years, and she deserves that recognition. I think you guys are doing perhaps better than some areas in our community, but I don't want you to, quote, as you said, pat yourselves on the back too much. It was a very profound presentation. And I like how you recognize that we need to pay attention to the 97%, because what this really is about fundamentally is a Band-Aid until we can move them out of somewhere else. You spend $1.5 million to provide rental assistance to 47 families and move 3 people out of the state. Brilliant. You talk about the kids are scared. No, sweetheart, the kids aren't scared. That's called bad parenting. The kids aren't scared. They think it's novel. They think it's fun. Bad parenting. Fix your parents, not your kids. Move along to where was a good question. Where are you moving along to? Well, you're moving them along to Iowa and Texas, apparently. We know from the homeless surveys that have been done now 2 times in a row by the Denver University students, law students, the #1 factor to ending homelessness happens to be stable housing. I know that would seem obvious. The #1 factor to combating addiction is stable housing.
30 seconds.
The #1 factor to long-term mental health stability is stable housing. Why are you spending millions of dollars on Band-Aids when we have over $1 billion in tax revenue on marijuana alone? You could give every single homeless person in the state $2,000 a month out of the tax revenue for marijuana. Maybe we need to focus less effort on Band-Aids at a local level and more money on effort on redirecting marijuana revenue to combat homelessness.
That's your time. Thank you very much. All right. Madam Clerk, and just to reiterate, you can press *9 to request to speak and then *6 to speak. And the last go around, we did not have anybody in the queue. So certainly maybe there was some confusion. Ms. Salazar, go ahead.
Phone number ending in 3751.
All right, good evening, 3751. If you give us your name and address or name and ward, we'll get your 3 minutes started. It looks like you're muted, so you'll have to unmute yourself with *6. If you press *6, you can unmute yourself. Madam Clerk, what were the last 4 digits?
I'm here. I'm here.
All right, there you go. Good evening. Give us your name and address or ward, and we'll get you started.
Well, I don't really have a name. Everyone calls me by Bobo on the street there. I don't really have an address. I have no idea what ward I'm in, but I'm sure I'm going to be moved to another ward soon. I was just suggesting, instead of spending all that money on all this, navigating, they call it, I was thinking, why don't you guys just put some gold wheels on my cardboard home, and then I can just wheel down the street and you'll never hear me again. And I'll use those gold wheels probably to build a bigger home. But if you do that, my golden wheels, they'll just look really nice. It will just spread. The word will spread. But look, man, if you get the police down here to push us out, oh, jeez, I don't think that's going to go very well. We have rights, you know. Do you guys believe in rights? Do you guys swear an oath to the Constitution to be in your public office? That's basically all I want to say. And that last guy, Eric Brandt, oh my God, he knows what's up. He's got it down pat. I really appreciate you guys trying to solve this homeless problem, but don't really help me unless it's golden wheels for my box. Thank you very much.
Great. All right, Madam Clerk. Looks like we have one more in the queue.
Number ending in 3437.
All right, caller 3437, you are up. If you press *6 to unmute yourself, give us your name and address or name and ward. We'll get you started.
My name is Frank Sturgill, and I'd like to first start out with a couple of points on the food insecurity issue. Grocery stores, especially ones that do make food, like Whole Foods, dump out tons of food every night. There's a lot of opportunity to lost food for food insecure people. There's got to be a way that you could have food insecure people get that food or take it every from these grocery stores each night. Also, Jeffco's Human Services doesn't have a very good record of food stamps. The last I heard, research I had read was that they had less than a 50% of approval rate of people that qualified. So that needs to be looked in if Jeffco is still not up to standards and denying people that are approved, that should be approved. Your point in time study, you had one spot in the whole city where you had a point in time study last year. And that makes it as much as 6 miles for people to go, for homeless people to go to. And that's not happening. You have a drastic undercount of homeless people in the city. And I suggest having multiple places throughout Jeffco. I mean, the Whitlock Center, Recreation Center, was the furthest south that Jeffco had a point in time study. It happens in late January. So to say you have an accurate count, that's just not true. You have hundreds, if not thousands, of homeless not being counted, at least hundreds in Lakewood alone. And the real cause of this problem is the intentional pushing up of homeless or of housing prices, which forces homelessness. It is a situation where there's no regulation on banks to do anything, and our legislators are not doing their job to oversee the regulation at DORA, and we have a terrible neoliberal criminal problem, and I do a lawsuit against them, and the Attorney General is so afraid he will not respond to my lawsuit because I have at least 3 admissions of failure duties to all, including Chris Kennedy, Tracy Kraft Tharp, Jay Danielson, and many others that are bribed by Lenders and Mortgage Lenders Association and many others.
Your 3 minutes is up. So thank you very much. All right, Madam Clerk, I do not see anybody else in the queue. That last number was the last one that we called on, correct? Okay, try to turn off that timer. Okay, all right, cool. Well, I appreciate, again, everybody's time and information and willingness to come together on this tough topic, and look forward to continuing to work. And I think it goes without saying how proud this community is of everybody here on the city side and the county side. And thank you so much for all of this. So with that, I will let you all go and we can go into reports. Okay, so we will start this evening at Ward 5 and work our way down to Ward 1.
I would say hats off to Dana for all the work that she did. We had a mental health workshop this last week, and lots of really good information. And I'm really sorry that more people didn't attend, but we had a great thing. So hats off to Dana for making that happen. Thank you.
Nothing?
I have no report. Thanks, Karen.
All right, Ward 4. Ward 3.
No report from me.
Okay.
I guess the only thing I wanted to mention is that we had discussed the investigation that I had requested last week, and I had stated that the investigator who was chosen against the policies and procedures. And apparently I've been told that that investigation is proceeding anyway. And so that's of concern. It's not a legal investigation. That's all for my report. Thanks.
Thank you. Ward 2.
Just wanted to say good seeing everybody. Have a good night. Thanks.
Nothing, Sharon. Okay, Ward 1.
I'd like to thank all the presenters as well. It's been a good discussion tonight. Thank you.
Ramey?
Yes, thank you. I would just like to remind everybody to please vote and to make sure that your ballot gets there. Just take it to the ballot box yourself. Thank you.
Great. Thank you. And to build off that, there are, I think, 6 locations, 6 or 7 spread out throughout Lakewood now to make it easy for you to drop those off. A special shout out to 2 great longtime residents who celebrated big milestone birthdays last week. Mr. Gardner, who's been active in the Two Creeks neighborhood for years, turned 95 years old. And then Luann Margotti of the Chicago hot dog stand on West Colfax turned 90 on Friday. We did a nice proclamation for her to honor that big day. So want to give a shout out to them. And next week will be our final reading on the budget. So as you continue to have questions, please get those in so we can make sure that we get you good, solid answers and lend itself for a good conversation going forward. So that is all that I have. Ms. Hodson, do you have anything? Okay. All right. Well, we are done now at 10:20 p.m. I appreciate everybody. We'll see you next week.